Hello, my friends. Jill Osborne from the Interstitial Cystitis Network. It is Sunday, March 12th. We just switched daylight savings time. It got me a little off track with my elder care this morning. But normally on Sundays at this point in time, I do a drop-in IC support group meeting. And this is for patients who have prostate pain, bladder pain, pelvic floor dysfunction, pain with intimacy, pain with driving, pain with coffee, pain with foods. If you have any urinary tract issues that are painful, I am here for you. Now we're streaming live on YouTube and on Facebook. If I'm looking here, I'm looking at Facebook. If I'm looking here, I'm looking at YouTube. Now, my purpose in doing these meetings is to be an educator. I'm not a doctor. I don't give you medical advice. My job is to open new doors. I want you to look at things in a very different way, potentially, and then send you back to your doctor with new and better questions. Hello. Hey, Mary. Nice to see you. Hello, Barbara. Nice to see you too. Hello, Facebook. Normally when I do these meetings, I do a little 30-minute intro. Hello, Gay. And then I take your questions. Kayleen. Oh, Kayleen, girl, I want to hear all about your physical therapy. I definitely do. But I did want to address a couple of comments that came in at the end of our last meeting. So hold on a sec. Ooh, okay, this is going to be tricky. How do I do this? Hello, Laura. Nice to meet you too, hon. Welcome. I'm glad, you're not alone. It's always, listen, when you're newly diagnosed with IC and or you've been struggling with pain for such a long period of time, you're going, I'm the only one. I know nobody who has this, right? Nobody. I thought I was the only one in California for years. I mean, I thought it was the worst case in the world, to be quite honest. Until, of course, I started my first support group meeting. And it was just so enlightening to meet other patients who were also struggling and to see that I wasn't alone, but more importantly, to learn from them, to get some insight from them. It was an IC support group leader who told me about diet. Up to that time, I was drinking a quart of cranberry juice a day, getting much worse rather than better. It was an IC support group that taught me first about IC, and now that I'm the long-serving IC support group leader in the United States, I want to try to give some of that wisdom back to you guys because it isn't just me, it's all of us. And the reality here, as I was hoping I was going to be able to pull up my previous chat, but I can't without messing up the stream. Somebody just posted on our Facebook page that diagnosed with IC, very, very severe pain, nothing worked. And then she got correctly diagnosed with adenomyosis. They stopped her periods. They gave her some hormones, now completely pain-free. And that is the perfect example of why we as IC patients, especially those of us who are not responding to treatment, we have always got to take a step back and revisit the diagnosis and make sure we're treating the right thing. Because as I've shared, for me, I had my first symptoms in 7th grade. 50 years ago. Bladder treatments never worked for me in all of that time. I might have gotten a little tiny bit better. Hi, Jennifer. But it never really got me back to that point where I wasn't struggling. What finally got me pain-free was pelvic floor physical therapy because, my symptoms actually started after breaking my tailbone in 7th grade. Laura says, people tell me IC is not really IC. It's a diagnosis given when they can't find an answer, that there is a root cause which needs to be found. Exactly. There is, honey. There is. Listen. Hello, Hadar. Do I believe in embedded UTI? Sure, I do. Do I believe that every IC patient has embedded UTI? Absolutely not. Absolutely not. Okay, so let me address Laura's questions first. Laura, if you were ever to come to a real in-person IC support group meeting, what you would see very quickly is diversity in this patient population. For some of us, IC begins in childhood. For others, IC begins after menopause. Are we the same? No. The child with symptoms, that older woman with symptoms, you're not identical at all. You're not biologically the same. For some people, IC begins after chemotherapy, while for many, many others, IC begins after falling and injuring themselves. I was working with a dancer just the other day. Probably all went back to when she was dancing and tweaking her pelvic floor. And for many of us, IC begins after some sort of trauma. And you really see the diversity when you look inside the bladder, because most of us have normal bladders. Only a small percentage, 5 to 10% of us, have Hunner's lesions, bleeding wounds in our bladder. Okay. And so that's very, very clear diversity. And when we biopsy those bladders, we also see tremendous diversity. Janie says, have you heard of Mona Lisa Touch or Thermeba helping any of our symptoms? Only if you have estrogen atrophy, hun. So if you look at our new national guidelines, Laura, which you can find over on the IC Network website, the guidelines are released by the American Urology Association. They are put together by a panel of IC researchers and patient activists, and it's all about making sure that we're all being treated consistently, because back in the old days, we were not treated consistently. It's about giving doctors and patients good, solid information. So 20 years ago, yeah, man, we all thought this was an incurable bladder disease. We all thought everybody had a damaged bladder wall. But this is what we've learned in 20 years. Bladder therapies often don't work. They just don't, for many of us, especially for those of us who have normal bladders. It's like, you've got all these symptoms. You're crying in pain. You have a cystoscopy. You're hoping your doctor is going to find it. My God, what is it? Please tell me what this is. And the doctor looks at you and goes, I'm sorry, there's nothing wrong with your bladder. God forbid you get the eye roll, especially from family members. Well, see, look, there's nothing wrong with you. No, that's not the right way to look at it. What it means is that, okay, it's not your bladder driving your symptoms. It means that something else is driving your symptoms. And that the bladder is victimized by something else that's happening in the pelvis. Some of you, for example, have varicose veins in your pelvis, we call pelvic congestion syndrome. So if you feel heaviness, like as the day goes on, you're getting, you feel like you're carrying a heavier and heavier and heavier weight in your pelvis, that's actually a varicose vein pooling blood. Some of you might have a fibroid tumor pushing on your bladder. I was working with a patient who had a big fibroid tumor pushing on her bladder, and she was, again, last week, and she was trying to decide if she was going to have surgery or not. And, it was one of those situations where she was older, she's past having children, it was a significant problem. She had fibroid tumors pushing on the outside of her uterus into her bladder, and she had a big something inside of her uterus, so that literally they couldn't even do a biopsy. It was really blocking her cervix. So in that case, hysterectomy is probably going to be the issue. So we do something called subtyping now. This is precision medicine, and this is new. And so if you look at our guidelines over the years, here's what our guidelines say, the ones that were released last year. Bladder treatments don't work for the majority of patients. If you're not responding to therapy, stop what you're doing, take a step back, revisit the diagnosis. And there are distinct patient groups. And we have to figure out what your patient group is. Because if you're a pelvic floor patient like I am, doing bladder therapies is pointless. If you have Hunner's lesions, doing amitriptyline maybe not particularly useful. If you are a widespread pain, pelvic congestion, widespread pain, central sensitization patient, then we have to do therapies that work on calming your central nervous system. So what precision medicine means is we find your subtype first, and then we find the right therapy based upon your unique presentation of symptoms. And so this is where all the active debate is okay, what are the subtypes? So we use Chris Payne's system for the last 6 years. It's been fantastic. AUA is not quite ready. AUA is still lumping people together. They're willing to say there are 3 distinct groups, but in the bladder group, they mix Hunner's lesions with everybody else. That doesn't make much sense, but that's what they did. And now we have a new system from Canada, which is 9 distinct subtypes. Thank you, Janie. Thank you for the 50 stars. And so It's getting better and better and better. Now, somebody asked, how do I feel about the theory of embedded infection? Well, embedded infection would fall into IC subtype 2 bladder wall driven. Okay, so in the bladder wall driven group, we've got 3 distinct patient groups. We've got we've got chemocystitis. So for those of you drinking a lot of diet soda, or those of you who've gone through chemotherapy, you've got to remember that your bladder can be injured just like any other part of your body, and generally it's injured through some sort of chemical exposure. And you know, there are a lot of you out there who really don't drink, you did not drink water, you just drank diet soda or sweet tea or something like that. Your bladder isn't designed to hold high levels of acid for very, very long periods of time over the years. So our therapeutic priority for the chemocystitis patient is to figure out what the chemical injury is, get rid of it, and give the bladder time to heal, because healing is always happening. You just are interfering with healing. If you're pouring acid on the wound every day, it's never going to get better. So chemocystitis is one distinct group. The biggest group in the bladder wall group, the bladder wall subtype, is estrogen atrophy. Absolutely, estrogen atrophy. And there are millions of women who have been told that they have an incurable bladder disease when they just have estrogen atrophy, and we know how to treat that. We're going to treat that with estrogen if we can, and with a treatment that will potentially protect and coat the bladder. So if your symptoms began after starting birth control, if your symptoms began because you went on Lupron for endometriosis, if your symptom began in your 30s or 40s, where we're looking at perimenopause, we always want to look at the quality and health of your skin. Because if your vulva is dry and your vagina is dry, so is your urethra and so is your bladder. And you have the equivalent of dry bladder. Think about how painful dry mouth is. Well, dry bladder is painful. And then last but not least, I do believe that there is a small group of patients who have embedded infection. But the question is, what type of infection? Because y'all are thinking bacteria. But guess what? Our own National Institutes of Health, which is the premier research team in the United States, if not in the world, it's called the MAP Research Network. They found fungus. They found candida in the urine of women with severe bladder pain. And if there's ever any group that is overexposed to antibiotics, it's us. How many of us, every single one of us, have taken antibiotics, even when our culture is negative? Because you're thinking it's got to be infection. It has to be infection. You got frequency, urgency, pressure, pain. Oh my God, doc, I've got an infection. But your culture comes back negative. But you know what? You're like, no, it's infection. You take the antibiotics anyway. Your doctor might give you more antibiotics. The doctor might say, hey, let's just put you on long-term antibiotics anyway. I did Augmentin for almost a year. Ended up with a very severe drug-resistant candida infection. It took me 2 years to kill the candida. So I am completely open to the concept that infection is present, but I'm not going to just sit in the embedded bacterial infection. And here's the deal. Urine is not sterile. There's supposed to be bacteria in there. Bacteria play very, very important roles in the health of the bladder. In the bowel, for example, there is a bacteria that actually creates the food that the cells of the bladder will eat. The human body doesn't make that food. It's very specific species of bacteria makes this food. And when you take an antibiotic, you kill that bacteria. Thus, the cells lining your bowel can't eat. They can't be nourished. We think the same thing's happening in the bladder, that there are bacteria in the bladder that nourish the bladder. So Hadar says, you want to ask if and when their bacteria and microgen test, does that mean there will be glomurulations on hydrodistension? Absolutely not. The glomurulations on hydrodistension happen when you stretch the bladder. When you stretch the bladder, you're going to break little areas of the bladder wall and you're going to get a lot of red dots. And if you look at our new guidelines, they've thrown the finding of petechial hemorrhages, glomurulations out. They're not meaningful. They're not unique to IC. It is what happens when you stretch the bladder with water. I can get a picture here. Hold on. This is my new project board. That's a start. That's a start of a new top secret project here at the IC Network. You're going to like it. I'm going to like it. Okay, so let us look, for example, at what a Hunner's lesion looks like. I love these pictures. Okay. So let's look at what wounds in the bladder look like. Okay. So these are Hunner's lesions. And you know what? Actually, this picture is actually a little bit better. So you're going to notice for many of them, there's a center point. It's called the coagulum. And then arms kind of radiate from the center point. Okay. They're characterized by bleeding a lot, waterfall effect. They call it a waterfall of blood. So this is real. These are Hunner's lesions. And these have actually been connected to viral infections. So again, when you think embedded UTI, don't think bacteria. This could be a polyoma or maybe even an Epstein-Barr viral infection, usually polyoma though. Okay. So let's look at that. Now this is an old picture. This is a picture of petechial hemorrhaging or glomerations on the bladder. Okay? This is what happens when you stretch the bladder. This is thrown out. Look at the new guidelines thrown out. This doesn't mean anything anymore. It doesn't mean your bladder's irritated. It means that they've stretched your bladder and broken pieces of your skin off. Just for show and tell, I want to show you something that's very interesting. Look at this. You know what this is? This is a bladder stone. And I've worked with a few patients over the years who have had bladder stones. It wasn't IC. They had crystals. And in some cases, they weren't drinking enough water. The minerals in their water came together. The stone got big, kind of like a kidney stone. The stone got bigger and bigger and bigger until they couldn't pass. And now you got this very sharp, ugly stone in your bladder that's floating up and down on your urine, cutting your bladder wall. And the thing about stones is that they're covered with bacteria. So not only are they sharp and cutting your bladder wall, but they're introducing bacteria into your bladder wall. This is a very interesting stone because this is actually growing out of the bladder. This is what happens if you have a very severe injury. So in this case, this was not IC at all. He had to have major surgery. And they had to sew his bladder back together, again, not IC. And the stones emerged on the incision line because severe injuries disrupt a calcium metabolism mechanism, and it takes months and months for it to come back. And so the calcium has to go somewhere, and so it grows out of the wall. Okay, and so, some of you are afraid to have a cystoscopy. Well, don't be afraid to have a cystoscopy. If you're uncomfortable, if you're in pain, it's important to let somebody look, because if you have a bladder stone, they can get rid of the bladder stone and you will feel instantly better. We had one patient diagnosed with IC, was afraid to have a cystoscopy, had pain for years. She finally gave in. Doctor said, let me look in your bladder. Bam, this is what she had. They took it out, symptoms went away, cured. She knew exactly when it started. She was traveling and she didn't drink water. Okay, and then just out of curiosity, and there's no relationship to IC at all. You just need to know. I'm just showing it to you, because I like to show it to people. I like pictures. IC is not related to cancer in any way. Okay, anyway. But if you want to see what bladder cancer looks like, that's what it looks like. Think jellyfish. It's like a jellyfish coming out of the bladder wall, and it kind of floats just like a jellyfish does. That's what bladder cancer looks like. Interesting, right? All right. This is my breakfast and lunch. Mary says, your opinion, please. I feel pain-free on waking. Then about noon, it starts with a burning sensation in my privates for the rest of the day. So, Mary, instantly, two things come to mind. Number one, is the burning accompanied by heaviness? Patients who have pelvic congestion syndromes, they sleep fine. They wake up in the morning, they're fine. But as the day goes on, usually around noon, things start to get more and more and more uncomfortable. So that would be concept one. Concept two is if you have estrogen atrophy, if you are of a certain age and your skin is dry, is there something in the morning that you're eating or drinking that is irritating your bladder that you would start feeling right by around noon? That would be what I would be looking for. Jennifer has a great success story. Jennifer has Hunner's had Hunner's lesions for 10 years. She just finished 3 months of hyperbaric oxygen therapy, and she's feeling so much better. Jennifer, congratulations. I'm so happy for you. Hyperbaric oxygen therapy is indeed a treatment for Hunner's lesions. Hyperbaric oxygen therapy is where you go into a room or into a machine. Sometimes it's a tube, sometimes it's a room. There's a lot of oxygen in there, and it pushes oxygen throughout your body, and oxygen helps your body heal. So we have research studies which have shown that hyperbaric oxygen therapy has been helpful for Hunner's lesions. So I'm so happy for you, hun. Oh, well, Mary says it's her pudendal nerve because she fell. Okay, so then the third thing that would help us understand why you're having pain around noon. I mean, people with pudendal neuralgia, you tend to sleep well. It's when you sit on the side of the bed, when you get up in the morning, that your pain first starts. Because when you go from laying flat to sitting, we now have weight pushing on that nerve. So I didn't think of that right away for you, Mary, because you said it starts around noon. But anytime your symptoms are positional, anytime you have pain when you're sitting, that gets better when you're standing, things like that, then we would definitely look at muscles that are squeezing nerves, something that's impacting a nerve. So if you fell, then yeah. So we have to go back then to try to figure out why your nerve is compromised. Do you have a muscle that's become tight because of the fall? And if that's the case, it would be very helpful for you to go back to physical therapy and talk with a physical therapist. All right, hold on a sec. Do you have to have pain to have IC? No, just frequent. You can have frequency, urgency, no pain. And she says, do you play Word Trip? Your new logo looks like almost identical. No, this logo was built for us 2 years ago. I've never heard of Word Trip. This logo was developed with a contest with graphic artists. It's very hard to come up with a logo for people with pelvic stuff. You should see my logos over time. Janie says, mine has been my entire life and became much worse after hysterectomy. Does anyone have problems taking estrogen because it flares their bladder? I've taken all forms and they all hurt my bladder. I can't take it. You know, Janie, when we think about our subtypes, I have always believed that there was an estrogen-driven subtype. Because for many patients, estrogen helps, but for some patients, estrogen makes it worse. And the example that I gave of the woman with adenomyosis who posted on our Facebook page, once they stopped her estrogen, her symptoms went away. So you might be in that group, hun. Hadar says, do the bacteria found in the lumulations make the lumulations? Absolutely not. Hi, Bonnie. Is quercetin good for IC? It can be. Quercetin has an antihistaminic effect. Almost all the good supplements have quercetin in it. That research was originally done back in the early 1990s at UCLA by Dr. Daniel Shoskis. Debayamon, is there a replacement for bladder rest now that it's $50 is too much for me now that I'm on and excuse me, unemployment? If we're going for a chondroitin-based supplement, bladder rest is still the most affordable one. Obviously, with manufacturing and everything and shipping, the Postal Service has raised shipping 10% in January. So it is now it's getting up there. It's not terrible. We have a really good volume discount. And so if you get, like 2 bottles or 4 bottles or 6 bottles, 5%, 10%, 15%, stuff like that. The other supplements that are more affordable have different mechanisms of action. So Allopath, this is aloe, which could soothe the bladder, with PEA, which could calm nerves down, but it doesn't have the chondroitin in it. And of course, Peora, if we're trying to calm nerves down, we want to think about palmitoyl ethanolamide. Laura says, I have fibromyalgia, chronic fatigue syndrome, and stomach problems. Got told that makes you at risk of IC. So I'm thinking it's my nervous system, hun. That's IC subtype 5. Technically, it's bladder pain syndrome phenotype 5, central sensitization, chronic overlapping pain conditions. If you have 2 or more of the chronic overlapping pain conditions, you are now in that chronic overlapping pain group. This is also my other subtype. So I have a history of IC, IBS, vulvodynia, migraines, TMJ, and that is driven entirely by the central nervous system. And we're going to be focusing very, very specifically on that. Okay, I just got an interesting email. Hold on, from somebody. Hi, John. Hi, Amy. Janie says, do laser treatments for atrophy possibly help dry the bladder? No, because you don't do laser atrophy treatments in the bladder. Just take a deep breath in, out. I'm really, really working hard on checking in with my body now. Sometimes I get myself a little worked up and I got to calm myself down. One more deep breath in, out. Charlie said, are there any other meds or treatments that can keep ulcers from coming back or new develop? They started me in cyclosporin for this. I've tried to take it twice, but got some side effects. Bladder installations in the past caused me more pain, so they stopped doing them. Charlie, Hunner, so if I were in your shoes, I would take a step back and we have to think about what causes lesions in the first place. So there's 2 fundamental theories on what causes lesions. Number one, that it's a viral infection. And that's research from Europe that has now been confirmed by American researchers also. When we go back to that National Institutes of Health MAP Research Network, they went back and looked at all of their urine samples, and they too found that in about 5% of patients, there was actually a polyoma virus infecting their bladder and that was living in their urine. This is not a sexually transmitted disease. This is a virus we all have. And it's a virus that it's part of what we call the virome, part of the human biome. It gets turned on in patients who are immune compromised. So, and you can find that research on the IC Network website, icnetwork.org. Just Google it. You can just search on the IC Network for virus or lesion, and you'll find the articles. They link right back to the research studies, and you can take that to your doctor and say, you know what, just out of curiosity, since my lesions are not responding to anything, could we just do a viral scan? Just see if you've got some active virus going on, whether it be Epstein-Barr, polyoma. Because if that's the case, maybe what you could do is try an antiviral, or at least maybe do some lysine, because lysine interferes with viral replication. So concept number one is, do you have an active viral infection that they might be able to treat? I don't know. You don't know. You'd have to ask for a test. But that's what the research is finding. And we've been looking at that for close to 10 years now. The other very interesting thing about, or the other interesting theory about Hunner's lesions is that it is a nerve that is massively inflamed. There's like massive inflammation in the center of that lesion. And remember, inflammation is a sign that your body's fighting something. It's biological war, right? And so when they biopsy that, they see a lot of white blood cells. There's obviously war happening in the middle of those lesions, which, again, that points us back to that viral infection. But we had a very interesting case study that was published a year and a half ago, maybe 2.5 years, no, a year and a half ago. It was of a woman who had severe Hunner's lesions. She had them for years, but she also had a prolapse. And her prolapse was so significant, they had to surgically repair it. And when they went in to repair the prolapse, they made an amazing discovery that her uterus was backwards, that the front of her uterus was facing backwards and the back of her uterus was facing frontwards. Why? Because she'd lost a ligament. One of her ligaments had broken. Actually, let's do that one. So what was happening is her uterus was swinging from one ligament. This is called posterior fornix syndrome. So the back of her uterus is facing frontwards. So think about what's happening in this area as it's twisting. You get what we call a strangulation, which is always very, very scary and severe, because if you've got tissue twisting, you're twisting nerves and you're twisting blood vessels, and it's never good. And so when they got rid of that and they restored the proper support for her uterus, her Hunner's lesions healed completely. And so that really supports the concept of nerves that are very, very inflamed. I mean, obviously, if you have Hunner's lesions, you've got wounds on your bladder. You got to be perfect with your diet. Hunner's lesion patients are the patients who are the most diet sensitive. If you're drinking coffee or soda or anything like that, you are absolutely making it worse. So you got to really lock down on that diet, get rid of the strong acids. I've had a lot of patients calling me drinking green tea in the last week because they say green tea is good for your bladder. It's not good for your bladder. Green tea is devastating for your bladder. Okay, so if you got estrogen atrophy or Hunner's lesions, please don't drink green tea or a black tea or white tea or coffee, any type, even decaf. You got to buckle down on that diet, and they can laser it. They can inject a steroid into the middle of the lesion. The steroid calms some of that inflammation down, or hyperbaric oxygen therapy, which would be no treatments at all other than you sitting in a chamber and breathing in good oxygen. So that would be very, very interesting. Laura says, thanks for the information about subgroups. No doctor or specialist has ever spoken about that. That's because it's very new, Laura, and it hasn't trickled down yet to local doctors. We're really only doing this at the upper national levels and international levels. Like I was at the participating in the National Institutes of Health IC research meeting last fall. That's the level that we're subtyping more. And it's very important that we trickle this down. And how are we going to do that, since urologists don't really go to conferences and take classes on that? It's you bringing in articles and helping them understand that. NIH AUA says 3 subtypes, but they mush a bunch together. Chris Payne's system, which we've used, focuses on 5 core subtypes, but he says there are more. Now we have a brand new proposal from Curtis Nickel, who is one of the top IC researchers in the world, and the top IC researcher in Canada, and honestly, probably the best writer of researchers in the world. I read every single thing he's written, and he just proposed 9 distinct subtypes. So he's got all of Chris Payne's subtypes, but he's added more. He's added an allergy subtype. He's added a urethral pain subtype. He has added a frequency urgency subtype. And he's added a flare subtype. And he's even given his clinical recipes, his treatment plan for each unique subtype. And you can find those all on the IC Network website. And if you're an IC Network member, we just released our winter magazine last night. You can sign into your member page, download your magazine, and we go all through it there. You can go over to the IC Network there too. Now, somebody asked, what is the difference between IC and overactive bladder? No, it's not pain, it's urgency. If you're running to the bathroom because you're going to leak and you're trying to prevent yourself from wetting your pants, that's overactive bladder. If you're running to the bathroom to reduce discomfort, that is a pain syndrome, a pelvic pain syndrome, a bladder pain syndrome, a urologic chronic pelvic pain syndrome, interstitial cystitis. Know that in Europe, they're not going to use the terms interstitial cystitis anymore, nor are they going to use the term chronic prostatitis. They are going right into using bladder pain syndrome. I mean, urologic chronic pelvic pain syndrome or bladder primary pelvic pain syndrome, stuff like that. It's a pain syndrome. Jennifer says, now Jennifer had the Hunner's lesions, went through hyperbaric oxygen. She said, I used to get up 6 to 8 times a night. Now I get up 2 times a night. My bladder holds more almost a cup of liquid, but you still get flares during stress. Any thoughts? Sounds fantastic, girl. I'm really happy for you. Now we all have to, this is the theme. Listen, this has been the theme of my life for the last year, especially the last 6 months. And it really is the theme of 2023, is understanding that we are all under massive levels of stress for many different reasons, not the least of which is COVID and everything that's gone on with COVID. And we have to understand the toll that stress takes on our body. When you're under stress, your heart rate goes up, your blood pressure goes up, and your muscles get tight. And if you're under stress for long periods of time, your muscles are going to stay tight for long periods of time. I am like really using my mindfulness I Spy, like I did it yesterday driving to my best friend's house. I'm needing this. I mean, I'm no longer going to try to hide it. I just, it's not helpful. I have to understand and accept that there are moments when I'm under an incredible amount of stress. And by acknowledging it, then I get to do something about it. I'm going out now. I'm walking away. I care for a 100-year-old and a 94-year-old. Hello, stress. I go out onto my deck, even if it's raining, and I do my I Spy technique. And I just ground my body with good sensory information. And I'm feeling so much better. I mean, I'm feeling so much better. I'm annoyed as hell. I'm so annoyed that my body, that I'm reacting to stress, but I'm human. We're all human. And the whole, negative thoughts, I mean, I have to work on that a lot right now. I was doing it this morning. I had to do it this morning. I was having some negative thoughts this morning about what, just the storm, the freaking storm. I'm so sick of the media deliberately scaring us and working us up. It's like, I just like want to put all of my internet stuff away. I want to put I'm not going to pick up my iPad today at all. I'm not going to look at Twitter. I'm not going to look at any of that. I'm not interested in going to any news channels because they're just playing us now. They're just trying to get us upset about something or worried about something. I don't need to be that anymore. I'm going to get my art pad out and I'm going to draw and watch the Academy Awards tonight. That's it. Chloe said, is there a link between high testosterone and IC? I have high testosterone. I'm 33 and every doctor I've asked won't measure my estrogen levels. I don't know. We don't have the research that's gone into that. But if you're high testosterone, does that mean that you're low estrogen? And then if you're low estrogen, that's certainly going to affect your bladder wall. Recently put on 50 milligrams of Mirvatrix, and now I have burning in my bladder. Anyone else have slight burning sensation in the bladder when taking Mirvatrix? That's unusual. That's important. Maybe 50 milligrams is too strong for you. Maybe you need a smaller dose. Tell your doctor that you're having that symptom. All right, Angie, let's see. Mary says, this is the problem. They're not aware of subtypes. I know. Amy says, did you get my microgen results I emailed to you? So interesting. You absolutely cannot count on a urinalysis or culture results. Since 3 doctors did these tests and they were all negative. Only microgen test at 89% high load of E. coli. What the F? Yeah, exactly. Amy, I'd have to go back into my email. Anne says, is quercetin good for IC? I don't know if you answered. It can be. It's an antihistamine. John says, I think I may be intolerant to Dandy Blend. Are there any other good coffee substitutes? That's where you're the first person. Totally believe you. You could do, I mean, they're all based around the same thing. You could do Pero, Cafix, uh, Caffrey Roma, Ticino. Maybe, John, maybe what you should try is a Rooibos tea, which is a brown grain tea that's like a step away from coffee, but it's still really good. It's kind so the tea that we have is, where is it? Here it is. Harney and Sons Rooibos tea, and we have plain Rooibos tea in the IC workshop too. It tastes great. I mean, this they label this pumpkin spice. It's not pumpkiny spicy at all. It's kind of like caramel, right? So you can see it's a brown grain. It's good. With these teas, they come in these silk bags, but we had research like 2 years ago that found that silk rather than paper bags put nanoparticles of plastic into our bloodstreams. And so and this is the only way this tea comes. And so I cut it out of the bag and I put it in a normal tea thingy. So this is like my favorite after dinner drink. I think that the Dandy Blend is a little strong for after dinner. This is sweet after dinner. A little bit of sugar, a little bit of cream. It's like a very, very gentle chai tea, but there's nothing in it that's going to irritate your bladder at all. So I would try the Rooibos. Mary says, do we all have completely different issues then? That would make more sense. Yeah, we do. We do. And that's exactly why most online support groups suck right now, because you can't put apples, oranges, and bananas in the same research study and in the same support group and expect it to be useful. And a lot of patients with estrogen atrophy are being terrified by patients with Hunner's lesions. And you don't have to be. You're different. That's why I'm doing these support group meetings on Facebook, because I want you to have good information. Angie sent me the logo. Let's see. Okay, and I've got another question. Oh, yeah, kinda. Okay, Myrna sent an email. Myrna, I was in the hospital a few weeks ago for severe pancreatitis. They found out that the PPI fluid retained in my body, they changed their IV to Ringer's lactate. Since then, I've not been going to the bathroom as much. Could you look to see if there's something in that would help IC? Very interesting to finding out. I don't know what the PPI fluid is that she's talking about. Huh, fascinating. All right. Rebecca says, my thyroid meds had to increase. Now my bladder is hurting more. I have bladder wall and estrogen atrophy. Is that normal? Well, the fact that you have estrogen atrophy means that any chemical, it means that your bladder's ability to defend itself is now reduced because you don't have the estrogen to produce that thick protective coating in your bladder. And so anything, it has a potential of irritating it. And so is there a chance that the thyroid meds have now kind of gotten to the level where they're creating more irritation? Possibly, but it's a pretty unusual. I take Synthroid. I've taken Synthroid since I was like 22. The last 40 years, it's never triggered my bladder, never. I will say, though, that generic thyroid medications suck. Oh, my God, the stories I could tell about generics. They gave me one because I used to take Levoxyl, and then I took something else, and then something else, and I like literally got some prescription of something, and I had all this really weird pain. I go right back to the pharmacy the next day, and I'm like, what's up with this? And the pharmacist goes, oh yeah, we're getting a lot of complaints about that. You got to remember that generics are often made in other countries and they're filled with crap. They're not as clean and as pure as, say, a brand name. That's why I only take Synthroid now. And hello, sensitive. I'm just like sensitive to stuff. All right, Laura, girl, you are like my sister. You did bladder installations last year, which caused a bad UTI. And of course, anytime we put a catheter in the bladder, we have the chance of pushing bacteria into your bladder. So you ended up with a wicked UTI, and you had to take 3 courses of antibiotics to kill it. And remember, a lot of UTIs are coming from food now. And in fact, Frontline has a new documentary on drug-resistant UTIs coming from meat. I love Frontline. I love documentaries like that. So don't assume that if you have a UTI, it means you're dirty or it means that you got it from sex. You can actually now get really severe drug-resistant infections from meat products, pork, chicken, even beef. It's happened with all 3. So because you took so many antibiotics, you got a wicked case of candida, just like I did. I had a drug-resistant Candida glabrata infection for 2 years in my bladder, on my vulva, in my vagina. And now you're left with internal soreness, which has never happened before. The doctor doesn't know why. Could that be an increase of IC symptoms? It's an increase of painful symptoms. And IC is a pelvic pain syndrome. So I would be asking, number one, is there a chance you still have candida embedded in your skin like I did? I mean, they kept saying diflucan will kill it. I was the candida poster child at my local Kaiser Permanente gynecology department. I even had one female gynecologist literally yell at me. I went in, I was crying in pain. Man, I'm telling you, candida in the bladder is agony. It was way worse than my original IC. And I was at Kaiser like every 2 weeks for almost 2 freaking years. It was so bad. And I had this one gynecologist yell at me. She said, Jill, it's impossible. You've taken diflucan. And I said, prove it. Do a swab. Take my pants off. She does the swab meanly. So, some doctors are like, bam, they hit you hard to take the swab. She was angry at me. And she came back, her jaw dropped going, oh my God, you have candida. And I'm like, I wouldn't be here if I weren't in agony right now. And she apologized. I'm sure that was one of the early super resistant Candida glabrata infections that I got from taking Augmentin for almost a year. Which is why we don't do long-term antibiotics for IC, because number one, we're not finding the bacteria in most of you. And number two, the risk of taking a severe, strong antibiotic over time is devastating to your body. It's devastating to your biome. We need good, healthy bacteria. Antibiotics kill everything. So I would want to know, number one, you still have it embedded in your skin. In the end, my infection was embedded in my vulva because I was sitting on a freaking hot heating pad. And even though I took lots of diflucan over time and did everything else, in the end, what was seeding it was a super deep infection in my skin. And I thought diflucan would kill everything, so I was not using the monostat or the nystatin on my skin regularly. And I was at the ER again, and he puts me up in the stirrups and he goes, oh my God, I can see it burrowed into your skin. Aren't you using the nystatin that we're prescribing for you? And I honestly said, not really, because I'm taking diflucan. And he goes, that's the problem, is you don't have enough blood supply on your skin for the diflucan to get there in any meaningful quantity to kill it. That's why we give you the topical nystatin. I was like, oh, And that was with a pharmacology degree. So anyway, Kayleen, I have polycystic ovarian syndrome that caused high testosterone. Oh, thank you for sharing that, Kayleen. Now I have clitoromegaly too, which is painful. You can't get estrogen levels because it changes throughout the day. I've been prescribed Myrbetriq, which really helps, but I'm getting tired of the dry mouth at work. I do have a cold burn in my low bladder and urethra sometimes. Kayleen, have you found these? Hold on a sec. Where is it? Xylamelts. Let's see it. Let's see if it'll focus. I love these. I love these little, you know, it's a little pill. It's xylitol. And you see it's concave on the inside. I don't know if you can see that. And so you can just put it on the inside of your lip and it will stay there for about 90 minutes and it will massively improve the dry mouth. It's like $20 for these, but it'll last a long time. The thing about xylitol is everybody has its own amount. And I could do 10 or 12 of these a day and it doesn't affect me. But some people, with some of the other xylitol products, there's so much xylitol, it will give you the runs. So you got to find the right product. So Xylamelt dry mouth are fantastic. I should be selling these in the IC Network store. Why aren't I doing that? That's ridiculous. All right. Donna says, what is a refreshing summer drink that is IC safe? Donna, if you go over to icdietproject.com, there are lots of summer drink recipes in there. You can do spa waters. You can do some bladder-friendly smoothies / juicy / shakes. You can do some ice cold teas, but they have to be herbal teas, specific teas. Go over to icdietproject.com and you can get some recipes. We also have some good recipes on the IC Network website. Go into our IC Chef Cookbook on the IC Network website. There's a bunch of free recipes there. Hold on. Or the IC Chef Cookbook. And you can get this online. It's $9.99 as a PDF file. You know what? I'll tell you what. For everybody watching this right now, would you like a free copy of this? I will send you a free copy of this by email. We do it as our giveaway today. If you email me, icnetwork@mac.com, icnetwork@mac.com, I will email you just because I'm having a good day. I will email you this book, which actually is $28.99 in print. $9.99 is a PDF, but I'll give it to you. Okay? Only for this meeting. I have to have the email by midnight tonight, icnetwork@mac.com. And so the recipes in here, let's see. Okay, we have a bunch of hot drinks, shakes and creamy drinks like coconut pear shake, coconut milkshake, blueberry milkshake, blueberry cobbler as a drink, iced and sweet teas, chamomile, honey, vanilla iced tea, sweet mint and basil iced tea, mint iced tea, bottled cinnamon mint iced tea. Then we've got fake mocha lattes. We got fruit smoothies. We got cucumber basil water, infused juices. We even have alcoholic drinks in here. And this is composed of recipes that IC patients have submitted to the IC Chef Cookbook on our website for many, many years. So these are all tested recipes. Okay, icnetwork@mac.com. If you would like a free copy of the IC Chef Cookbook, email me, icnetwork@mac.com. Can I spell the name? Yes, it's like chai tea. It can be robust. This is Harney and Sons Pumpkin Spice Tea. It's over on the IC Network website in our shop. It's rooibos, yes. Hi, Lori. Lori, can you tell me any good IC doctors in Southern California? Anywhere in Southern California? There's a ton of good physical therapists down there. You got one. You literally have probably the best physical therapist in the world in Los Angeles. Her name is Stephanie Prendergast. But there are a bunch of good physical therapists down there working with pelvic pain. And so what I would do, and you can in California, you can self-refer to physical therapy. So if you think you have tight pelvic floor muscles, I would contact one of the pelvic floor offices and then ask them who they're working with, because a lot of the doctors have retired and some of them have moved. So Larissa Rodriguez, who is at UCLA, is now back east chairing another department. And then there's another doctor at UCLA. Oh, it's interesting, the Academy Awards tonight, and we actually have actors and actresses who have had IC that I have worked with personally, who have gone to UCLA for care. One of whom won, I think he won an Emmy Award. Yeah, he did. I won't say who, even though he's talked about it publicly once. Lori says, what meat? Any meat. Amy says, I see Dr. Bosch in San Diego area. He's been my IC doctor for 14 years. Lori says, what killed the drug-resistant infection? I don't know. These are superbugs. I think ultimately in the end, they just work down their list to the more dangerous antibiotics. You get to the vancomycin, and then there's a couple after vancomycin. And then once you've gotten through that, there's nothing else. And so they have to just put you in the hospital and hope your body will kill it. Amy says, I won't ever take antibiotics until the microgen PCR test confirms it. Ironically, I will tell you that I am taking antibiotics right now for my bone graft, which they think got infected. I had a tooth removed, and I've had 2 bone grafts in 3 months for a hygienist who broke 2 teeth doing a cleaning. I'm so frustrated with her. And just the pain was just, ugh. It's been 3 weeks since I've had, 3.5 weeks since I had my bone graft. And sometimes I get pain in the last tooth, and sometimes I get pain in my eye tooth. I'm wearing my flipper right now. That's why my teeth are weird. Sometimes I get pain that shoots across my front teeth. So I am taking amoxicillin right now, and I'm having my yogurt every single day to try to repopulate my bowel with good bacteria. I actually feel better. Amy says, I took Macrobid, had horrible headaches and body pain after 2 pills, stopped, and they switched me to Bactrim, and that caused horrible nausea. This is the tricky part, is finding the antibiotic that will work for you. I will tell you, Amy, I took one Bactrim DS double strength before sex. And this was in 2006. I was supposed to go down and chair a big IC conference in San Diego. I took one freaking Bactrim DS, and my ears started to roar. I had a semi vibrating in my brain for 2 months, which is a known side effect of some meds. I couldn't go to the conference. I couldn't get on a plane. I was dizzy, all from one freaking Bactrim. So there's only 2 antibiotics that I'm not afraid of. Amoxicillin, which is what I'm taking, and Keflex. So it's just about finding what works for you, hun. Kayleen said, I've tried Biotine, but it doesn't do anything. Yeah, I mean, this one's a lot better. Kayleen, this one's a lot better than the Biotine. I just drank 40 ounces of water in a 4-hour shift, and I feel better everywhere. Maybe my urine will get compared to yellow chemistry. Yeah, Amy, it does. For anybody who wants to know what a microgen test looks like, here you go. This is the last one I did. I did it in 2019. And so what they do is it will identify all the bacteria that they find. This was actually a vaginal swab. This was not a urinalysis. I have a urinalysis one too. So in this case, I had dominantly lactobacillus, a little bit of Prevotella, a little bit of Streptococcus, and a tiny, tiny bit, so much so that it didn't even have a percentage of Gardnerella. The Prevotella is kind of what freaks me out. That was weird. And then what you can see is over here, it says antimicrobial recommendations. And so they have the different types of the antibiotics, and then they have little check marks to say which antibiotic will kill this bugger, right? The most important part of this is right here, resistance genes detected. And I know for you guys on YouTube, this is all backwards. What you can see is that I have a drug-resistant gene for aminoglycosides. Therefore, aminoglycoside antibiotics would make no sense since my bacteria, every single time I test, I'm resistant to aminoglycosides. Makes no sense, my friends. I'm a pharmacologist. That's my training. I have never in my life taken an aminoglycoside. Never. Believe me, I know what I've taken. I was a nerd as a kid. I know what I took. I went into pharmacology because I was very interested in that. How the heck did I get an aminoglycoside resistant gene? Had to come from food. It had to come from food. Or maybe if I were having surgery, maybe they gave me an injection of something. Erica, no K, MAC.com. It's short for Macintosh Computer. Anne says, is the pumpkin spice good? It's wonderful. Love it. Erica says, can you please give me your thoughts on my thing regarding pelvic floor? Erica, you might have to ask it again. If I missed your question, ask it again. Don't take it personally. Facebook always moves stuff quickly. Missy, hello, Missy. Missy on YouTube says, does IC cause your privates to burn on the inside when urinating? No, but estrogen atrophy does. If when you're peeing, it feels hot, like it's burning you in your urethra, and especially on your vulva as it's coming out of you, that is estrogen atrophy, hon. That means your skin is dry. And that's very, very treatable with topical estrogen. Okay, my hair is being weird. John said, I've read a couple of stories where people have benefited from Humira. Is that being researched? Yes, it has. There was a clinical study on it several years ago. It doesn't come up very often, to be quite honest. Let me look here. I think I did a clinical trial recruitment for Humira like a decade ago. Yeah, it was. Look at that. I'm right. It was in 2014. It just doesn't come up. It's not mentioned in the guidelines. It's been approved for the treatment of rheumatoid arthritis, psoriasis, spondylitis, and Crohn's disease. It's not approved for IC. It's not something that I can really talk about. I'm sorry. Judith says, have you talked about Botox treatments? Not yet today. If you want to talk about Botox, we can talk about Botox. Botox is botulinum toxin A. You know it because they inject it into your forehead to prevent wrinkles. Obviously, I've not done that. They can use Botox to stop a muscle from spasming. So if you have TMJ, They can use it in your neck to try to stop that. They can use Botox in your pelvic floor if you're having issues with tight muscles in your pelvic floor that are not responding to treatment. And they can also inject Botox directly into your bladder wall. Oops. The challenge with Botox therapy, so, when they do it in the bladder wall, they're just picking spots and injecting it, and they're hoping they're going to reach the nerve, which is driving your frequency, urgency, or your pain. But sometimes they end up numbing the nerve, which controls your ability to urinate. So this is why Botox has been a step 4 or step 5 treatment in the last revision of the AUA guidelines. Now Botox is really only suggested in certain circumstances. And I know Curtis Nickel in his 9-point system, let me look and tell you where he used Botox. I don't, he's got 9 subtypes, and it was only in one subtypes did he use Botox. Let me see if I can find it. As a last resort, Botox A can provide short-term symptom relief, though it carries a risk of urinary retention. These are patients who have intense frequency urgency. So that's the only context in which he uses Botox. Thank you for the 99 stars, Laura. You guys, if you find these meaningful, you can, if you're on Facebook, you can give us stars. I think we get a penny a star. But more importantly, come on over to the IC Network and sign up for our free newsletter because, hey, it's free. And I don't abuse you. I write all of those. I send out a newsletter maybe every 2 months. I'm going to be sending out several newsletters, though, on new clinical trials this fall. You can always unsubscribe whenever you want. And you can also become a member and get our magazine, the IC Optimist. And you can, depending upon the membership you get, you can read them online, $25. You can have them mailed to you, $50. And if you get our $100 membership, you get our books too. So anyway. Tanya says, so frustrated. You have vaginal atrophy. Used estrace, felt better down, but the estrace gives you headaches. So I stopped it. Now I have burning. I can't see the inflammation, but it feels like nerve pain. I guess I have to go back on the, well, Tanya, that is maybe you can talk to the, to your OBGYN about trying a different compounded form. Estrace and Premarin are especially Premarin. Premarin is probably the more challenging one because it has alcohol in it and a lot of extra preservatives in it to expand shelf life. So for patients who are super sensitive, like me, who struggle with sensitivity, we do better with a compounded estrogen cream. So I get my estrogen from the Women's International Pharmacy in Arizona, and it is propylene glycol free. Propylene glycol free and preservative free. And so you might just be burning because of the brand name estrace. Ask your doctor if you can try a compounded formula. Also, there are some patients who are just super, super sensitive anyway to the base. The Women's International Pharmacy have a number of different bases they can try. They can even put it in coconut oil or something like that if you're super, super sensitive. So that's what I would consider doing, Tanya. Amy says, John, Humira has been studied and it's not effective. Thank you for looking that up. Lori says, I'm doing so much better since being on here since November. Worst IC flare I've ever had. Lots of water, no coffee, soda, very strict diet. I absolutely love my Dandy Blend. Thank you. Yeah, baby. I love these success stories. Tanya says, what can you use daily to soothe the vagina and the vulva? You can use a V Magic or coconut oil. Let me get the V Magic. Oh. Here it is. So V Magic is literally probably the best product on the market for people who cannot use estrogen cream for one reason or another. Okay, and it so closely mimics the normal. I don't know if you can see that. It kind of looks like Vaseline, but it's not sticky like Vaseline. Can you see that? It's hard to get it right. Sorry, I've got the light. It's very hard. So there it is on my finger. You know, and it's just perfect. It's very light, and it's a great way to coat your vulva when you have estrogen atrophy, so that urine is not so irritating. So again, it's called Medicine Mama's V Magic. If you can see that. And it's available over in the IC Network shop. So please buy it from us rather than going to Amazon. Number one, it's probably cheaper here, but even if it's not, it helps support these meetings. I will say, and although it hasn't happened recently, I have, you guys know I do coaching on the phone. It's free. You can just call. And if I'm available, I'm happy to talk to you. And a couple of times I've worked with patients for like an hour. Worked with a patient the other night for 2 hours. Who was really struggling. No charge. It was absolutely fine. And we started talking about supplements. She goes, well, who has them the cheapest? I'm going to go buy it. And it's like, well, I don't want to send you to Amazon. Come to my store. Right? It's a little offensive. It was just a little insulting. But anyway, we have to pay the bills some way. And we pay the bills for the IC Network by having stuff in our store, like heating pads and chair cushions and V Magic and some supplements. Erica says, my insurance won't approve more pelvic floor physical therapy because they said I'm close to reaching my goal. I have no improvement. Therapist said this is the game with the insurance. So it's a therapist's job to make the case, and you have to be asking your therapist. Really, the most important question that you have to ask your therapist is, are my muscles slowly improving, or are they always going back into tension? Because if your muscles are always going back into tension, now we've got to look beyond the muscles at bones. Do you have a bad hip? Do you have a bad SI joint like I do? A bad knee? Something wrong with how you're walking that's influencing and keeping your muscles under tension? Because if that's the case, we have to start trying to figure that out. We have to figure, if you're not walking normally. Many patients who have long-term chronically tight pelvic floor muscles don't walk normally. They just don't. Karen says, what's the best protocol to help estrogen atrophy? Topical estrogen. That's absolutely the best protocol. And it's considered very, very safe in the research. Ursula says, I sit in a recliner in the evening and I think it causes me to flare. I feel better when my hips are not in that inclined position. Why would that be? Pelvic floor tension, hun. It's a combination of gravity and weight. I sleep in a recliner. I've been sleeping in a recliner for 2.5 years now because of my TMJ. If I sleep on my back and on my left side, my jaw starts to dislocate because I got ligament laxity right here. In fact, I finally have an appointment in August to go see a TMJ specialist to try to fix this because I would love to sleep in a bed. I'm just sleeping in a recliner. And the thing is you have pressure points, hon. So it's about, and also look at your feet. Like I can feel, if I have my knee, you know how sometimes when you're sleeping, you bring your feet up and you open your legs and you're just trying to find a comfortable position. You're moving around. And it's really interesting when you visualize what your pelvic floor muscles are doing at that time. Because if you're opening your knees, you're pulling your piriformis muscle, and that makes tension on that muscle. And sometimes I can feel that. Denise says, what's your feeling on inferior hypogastric plexus blocks for IC? Well, it depends upon how you define IC. Plexus block for pudendal neuralgia and for pain, sure. It can be diagnostic. It can be therapeutic. But the assumption there is that we have an issue with a nerve, or we're just trying to bring pain down real quickly. Okay, so you guys, I'm going to make this offer again for anybody who wants a copy of the IC Chef Cookbook during this meeting. If you email me at icnetwork@mac.com, I will email you a copy of it. It's a big file. It's like 2.5 megabytes, but only during this meeting and maybe up to midnight tonight. But don't go on your groups and tell 100 people to do it, because that's not fair. It's for people who are here at this meeting. Barton says, I'm taking oxybutynin now. Can I add wine into my food, or should I avoid it? You should avoid it right now. Oxybutynin is not protecting your bladder wall. Oxybutynin is calming nerves down that are making you pee, but you still might have a bladder wall issue that alcohol can irritate. Palm says, hey, Jill, I bought the PEA, and oh boy, it helps. Awesome. Love Peora. I love Peora as a supplement for me. It really calms my nerves down. So getting back to the oxybutynin is prescribed for people who have frequency urgency, or if you're having bladder spasms, not pelvic floor spasms, but bladder spasms. The problem with oxybutynin is that over time it deadens the muscles in your nerves and in your bladder, and it deadens the nerves in your bladder, not the muscles, the nerves. Thus, over time, over a couple of weeks, it becomes harder and harder to urinate. It starts to feel like your bladder is numb. And it took I think I took it for 3 months back when I was first diagnosed. And then finally at the end, it's like, no, I got to pee, and I could not pee easily because of the oxybutynin. So I have only used oxybutynin once since then in 30 years, and that was with an infection where I had bladder spasms. Tanya said she needs to look into V-Magic. You were using A&D ointment. Yeah, no, the A&D ointment's too thick, way too thick. This is way, way better. Way, way better. V-Magic. Donna says, can you have a flare going on 6 weeks now? I went and had a urinalysis for UTI. Everything was fine. So I can stress you this because my husband has liver cancer. Oh, Donna, honey, I'm so sorry. I'm so sorry. You just found out, and the treatment he's having, oh, girl, now he goes into surgery Tuesday for pores so they can drain fluid that is in his stomach. Oh, honey. Well, of course you're flaring. This is brutal. Oh, honey. And you've had bladder augmentations. You're in a lot of pain. You have also bent your tailbone. Okay. So, number one, everybody, please, would you please do me a favor and just say a prayer for Donna and her husband. Life is just so freaking unfair sometimes. And Donna, I'm so sorry that you're going through this. And the big C, anytime you're given a cancer diagnosis, as I have been too, it's just your world stops. It's like, whoa. And everything changes. With my uterine cancer, as I said, it felt like I was blindfolded and thrown into the back of a car, and I had no idea where I was going and who was driving. I just like, it was up to God at that point in time. I was being driven around. I wish that when people gave you diagnoses, your family a diagnosis of this, that they actually had good support to help you cope and get through it, because this is really, really hard. But I also want you to remember in the best possible way that you are a strong MOB. You are strong, girl. You have had Hunner's lesions. You have had 2 bladder surgeries. You have never been more prepared to deal with whatever happens in your life than you are at this very moment. You are strong. And I know you're scared, but I want you to focus on your strength. You got here. You're going to get through this. You're going to help your husband get through this. You're going to bring your family together and be the mom and the wife that you're meant to be and that you are. You also have to be real pragmatic about your stress level now. It's going to be very, very, very important that you find moments for you and for your husband where you guys can chill every single day, whether it is after dinner, putting on your favorite music, just taking 30 minutes out of every day just to find a little bit of peace, get some laughter in there, watch funny videos. If you ever need a pep talk, you can call me. I'm real good at pep talks. For your flare, listen, you've had a lot of surgery. You fell, you broke your tailbone. I think that your pelvic floor is probably toast right now because when you're under stress, your muscles get super, super tight. When you go to pee, can you start your stream right away? Or are you hesitating 5, 10, 15 seconds? If you're hesitating, then your muscles are tight. So it may be that you're going to need to do some pelvic floor physical therapy, or if you have your internal wand, your glass wand, that you can do a little bit of internal work at home. I would look at that. This would be a really good time to maybe just double down on your diet, try to protect your bladder as much as you can. And maybe, throw in some supplements in there just for some good health, like some bladder builder or something like that, that would coat and protect your bladder a little bit more with something that would calm nerves down and try to get some of the chill off. Of course, talk to your urologist, get a proper urine test. Let's make sure you don't have an infection. This is going to be tough, but you're tough. I don't want you to sit at home and cry. I want you to ask for help. I want you to call your urologist and tell them you're in a terrible flare. Tell them that your husband's been diagnosed with cancer. Tell them that you're really, really struggling. Maybe the doctor can do some rescue instills. Maybe that would help break through this. I would also be looking for a liver cancer support group because there are other people who have gone through this journey. You don't have to recreate the wheel and do this all on your own. And you need support as a wife. He needs support as a patient. Get online and look for liver cancer support groups also. Okay, honey? This is a hug. Or you can tell I'm a K-pop fan. Mary says, I got a vibrating wand. Works great. I was told my right side inside was a brick wall. Yeah, tight pelvic floor muscles feel like tight beef jerky. Palm said she bought the PEA version for your dogs with arthritis. Interesting. I don't know. I have no idea on PEA safety for animals. I have no clue. So I hope you've done your due diligence and read through it. Mary says, great analogy about being blindfolded and thrown in the back of a car. Yeah. Yep. Donna, what are your thoughts on hydrodistension? Well, hydrodistension is a way of looking at the bladder wall more closely. It used to be the gold standard way of diagnosing IC back when we all thought that IC was a bladder disease. Now, if you look at our new national guidelines, hydrodistensions are only done if the diagnosis is in doubt or if there is something that is concerning your doctor, like a lot of blood in your urine, or if you might have a Hunner's lesion. In the old days, they did what we call a high-pressure, long-duration hydrodistension, where they put a lot of fluid in your bladder under very, very high pressure for a long period of time. The theory back then was that the more you stretch the bladder, the better. But unfortunately, bladders broke. Bladders burst open. And so since 2011, our guidelines have specifically said, do not do that. Do not ever do a high pressure, long duration hydrodistension again. Instead, we do what we call a low pressure, short duration. We use a little bit of fluid for a short period of time, do a quick look in the bladder, look around, pull it out. So these pictures that I showed you earlier of the bladder, you know, these were all done during a hydrodistension, okay? I had a hydrodistension with my hysterectomy with piece of cake because it was low pressure, short duration. Some people, you know, back in the old days, hydrodistensions were considered therapeutic because you often felt better when they stretched your bladder. But the reason you felt better is because when they stretch the bladder, it breaks the nerves in the bladder wall. So the nerves are literally broken, thus you don't feel the pain. You might not feel the frequency urgency, but the nerves always grow back. And sometimes more nerves grow back than you originally had. So hydrodistension is what I call a destructive therapy. The reason it feels good is because it's destroying the nerves. But the nerves always grow back, and you get stuck in this vicious cycle. It's very, very rare that a patient would be treated with a hydrodistension several times a year, although ironically, one of my staff members, it's the only treatment that works for her. And she's quite elderly now. Denise said, yes, pain is amitriptyline is helping. The problem with amitriptyline is that there are a lot of side effects to amitriptyline. Dry mouth, dry eyes, irregular heartbeat, and most importantly, weight gain. We call it the Eleville 20. I just immediately gain 20 pounds because you start craving. You start craving it. The problem with amitriptyline is that it is an anticholinergic medication. And anticholinergic medications have now been linked to dementia. So if you take amitriptyline every day for 3 years, you have like a 50% greater risk of dementia, cognitive decline. So we pulled way back on the amitriptyline now, and instead Mirbitrix is the preferred medication because it is not an anticholinergic. And these were warnings that were issued years ago, big research studies originally done in England, absolutely done and replicated here. There's one other thing about the amitriptyline that was important. It just went in and out of my brain. Mary says, I've read that pudendal neuralgia is very rare. Do you agree? No. And in fact, if you read this book, oh, wait. Oh, my thing got stuck on my ring. Ow, 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 ow. Ow, there you go. Okay. You want to know, aside from the book I wrote, IC 101, which is the best IC book, especially for newly diagnosed patients, this is the best book ever written for pelvic floor patients. Breaking Through Chronic Pelvic Pain by Jerome Weiss. This is a master class in muscles, nerves, injuries. If my goal is as you're laying on your back in a physical therapist's office and they're doing internal work, I want you to be able to visualize exactly what they're touching. This book will walk that through for you. This is amazing. It's filled with success stories. So Breaking Through Pelvic Pain, a holistic approach for relief by Dr. Jerome Weiss. We have a deal with the doctor. He's in his 80s now. And so we get it $6 cheaper than you can get it at Amazon. I encourage you to get the paper book. I think it's on Kindle, but the advantage of the paper book is that obviously you can highlight. And when I read something like this, I study, and I have to draw. I have to incorporate colors for my brain to absorb it. And so these are his pictures Distinct muscle groups and trigger points. See that? See that? These are the psoas muscles in the back. I used to get a lot of pain at my left side down here. I have got to get that spot on my hand checked. So Breaking Through Chronic Pelvic Pain is the bomb. It is a fantastic book. I am so frustrated. He was practicing in San Francisco. I'm 80 miles away. I am absolutely pelvic floor driven, and I did not go to see him because I was stuck in Kaiser. And I'm completely convinced that if I had gotten into his office 20 years ago, 25 years ago, I would have been better so much quicker. Donna says, my doctor put me on oxybutynin for years. I still take it. Should I stop? I do have trouble peeing. I have to push my stomach. Well, you're not girl, you need to talk to your doctor about that because oxybutynin is also an anticholinergic, hun. And so I would certainly be reducing dosages and talking about trying to get off of it and trying to find something else. I mean, ultimately, in the end, you're chasing your symptoms with the oxybutynin. You're not fixing anything. You have to differentiate in your brain between cause and effect. The symptoms are the effect. We have to figure out what the underlying cause is so that we can fix the underlying cause so that you don't have the symptoms in the first place. And that's the ultimate dilemma that I see patients struggle with is you get so frustrated. You just want treatment, and you'll do whatever treatment they give you for years and years and years. But the problem is you're not fixed. And that's what our AUA guidelines say. If you're not responding to therapy, if you're getting worse rather than better, or you're doing the same treatment over time and you're still flaring, it's not making you better. You're just chasing the symptom. We have to take a step back from that and really revisit this and do a proper subtyping. And Donna, if you want to call me this week, I would be happy to go through the subtypes with you and see if we can subtype you and maybe look at this from a different perspective, right? But I'm concerned that you're having trouble peeing. You have to push your stomach to get pee out. That's either the oxybutynin, just numbing those nerves, or severe pelvic floor dysfunction. But that's important. Urinary retention is bad. The more you retain, the greater the risk of infection. So I'm very concerned about that. Hadar says, so fullness bladder feeling 24/7, it's matched to is it a match to embedded UTI or interstitial cystitis? Girl, you're completely missing what interstitial cystitis is, Hadar. Interstitial cystitis is not a disease. There's no bladder disease happening in the vast majority of IC patients. That's what our guidelines say. There is no disease process happening in the bladder wall of patients with interstitial cystitis bladder pain syndrome, except for those patients with Hunner's lesions or maybe infection. But the vast majority of us have no disease happening. There, you can't compare the two at all. The bladder can be injured. You have to think of it instead as a neuromuscular disorder, which is exactly what the guidelines say. It is a pelvic pain syndrome driven by a dysfunction of nerves and muscles that are affecting the bladder directly. So interstitial cystitis doesn't mean anything anymore. Everybody around the world agrees in the top IC circles, it's the wrong name. This was a name that was picked back in the 1920s when they thought that there was a problem with the interstitial layer of the bladder. And we've known this since the 80s, the 70s, the 60s, that it is the wrong name. We've just been stuck with it. You need to think of this as a pelvic pain syndrome. And now we have to figure out what's driving the pelvic pain. Could it be infection? Absolutely. Could it be chemical injury of the bladder? Absolutely. Could it be estrogen atrophy For many of you, a huge chunk of you, it is estrogen atrophy. For many of you, it is a muscle problem. But what it is not is a bladder wall disease anymore. How do we know this? Because bladder wall therapies don't work for the vast majority of us. Think about Donna here. She's been taking oxybutynin for years, and yet she's having a terrible flare. Obviously, it's not fixing the underlying problem here. So does that make more sense? It is a pelvic pain syndrome. Your job as a patient with your doctor is to figure out what's driving it. Could it be a chronic infection? Absolutely. For a tiny percentage of you. Tiny. And the question here is, what kind of infection? Don't assume it's bacteria. It could easily be a candida infection. It can be a fungal infection, or it could be a viral infection. What's COVID cystitis? What is COVID cystitis, my friends? We knew 2 years into COVID that patients with no history of bladder symptoms were suddenly developing symptoms. It's called de novo cystitis. Here you have a patient, no history of bladder issues. They got COVID, bam, severe bladder issues. Why? Why? Because of the inflammation of the COVID infection affecting the bladder, the cytokine storm. But guess what? They've also found the COVID virus in some bladders. Don went to the ICA conference yesterday. They talked about PEMF therapy as being helpful. Do you have any experience with that? Can you, the initials are not coming for me. What does PEMF stand for? How was the conference, hon? That was in Florida? Every couple of years, the IC Association will do a little mini conference somewhere. They did it this spring in Florida. PEMF therapy. Honey, I'm just having a brain zone right now. I'm not, what the hell does that stand for? Come on, I should know that. PEMF. Oh, just it's an electromagnetic therapy. Okay. I did the pulsed electromagnetic therapy. This is definitely in the forefront. More and more doctors are exploring the concept of magnetic therapy, and we just did a clinical trial recruitment for Dr. Jason Kutch at UCSF, who is doing transcranial magnetic stimulation of the brain for patients who have central sensitization chronic pain. So that's very cool. I'd love to hear any other news from the conference. I mean, I'm not in Florida, so obviously I couldn't go. Erica says, you got a TENS unit in the wand? Awesome. Kayleen, sorry this is long, but it's about my physical therapy. And also, does anybody want to do Zoom? If you want to do Zoom, we can set up a Zoom meeting. If you want to come in and ask me questions directly, just let me know. All right. So sorry, Kayleen said, this is long, but it's about my physical therapy. She's being a total jerk. I only told the receptionist that she hasn't been doing the internal work lately. I accidentally went there thinking I had an appointment. We talked for 7 minutes and it was nothing but snippy attitude. She told me she already taught me how to do it on my own. I've told her over and over that it's triggering me for abuse. According to her, I have a pelvic floor physical therapy degree. An excuse from her is that bladder installations hurt me and she cannot do internal work. Honestly, only one has hurt because I jumped and the doctor scratched my urethra. She asked me where the dilators are, pretty much saying it should be a financial priority for me. If she prescribes it, I get it free from insurance. All I'm asking from her is more internal work than I'm getting. She's taking it so offensively. I can't get a new PT because she's the only one around. I've talked to my sex therapist and we're going to talk more about it Thursday. I don't know how to approach her without her being defensive. My hands are tied. Kayleen, I got to think about that, girl. Mary says, oh my God, that's a terrible physical therapy person. I just have to think about that. Is PEA good for arthritis in the neck? Well, we can Google palmitoyl ethanolamide arthritis and see. PEA is stands for palmitoyl ethanolamide, has been used in Europe for years for pain. And we have a 2019 IC research study that was stunningly successful, over-the-counter supplement that is believed to calm nerves down. It's called Piora in the IC Network store. The study came out in 2019. 87% of IC patients who use PEA reported a significant reduction in their pain and discomfort by month 3. And I think it's really ideal for patients with central sensitization or neuralgias, anything like that. So let's see here. One clinical trial found PEA was more effective than ibuprofen in relieving the pain of TMJ, osteoarthritis. I have arthritis in my right jaw. The anti-inflammatory of PEA ameliorates osteoarthritis-induced monosodium iodoacetate in Sprague Dawley rats. There are lots of studies with arthritis, so New Australian study finds PEA could be the answer for osteoarthritis. Again, a 2019 study. PEA shows considerable versatility in counteracting inflammation and offers benefits for arthritis. Let me do this. Let me just so for on Facebook, since the question came from Facebook, I'm going to copy and paste the scientific name for it in. You can copy what I just put in and Google palmitoyl ethanolamide arthritis and look at the research yourself. Chi says, I've been taking amitriptyline for years, but since I'm on Ozempic, I lost 40 pounds and don't have cravings. I can't take any of its sisters. I take it more for vulvodynia than for the bladder. Okay, so Chi, did you know that a lot of vulvodynia is caused by tight pelvic floor muscles? Tight pelvic floor muscles that are squeezing nerves? And that physical therapy is actually remarkably successful at reducing vulvodynia symptoms. So again, you're chasing symptoms. I understand that. I've had vulvodynia too. I've had very severe vulvodynia. I had very severe vulvodynia in high school. And it was caused by the tight pelvic floor muscles that happened when I broke my tailbone in junior high. Of course, we didn't figure that out until I was in my 40s. But now that I've done physical therapy, I have had no vulvodynia. But I will say after I had my hysterectomy, my muscles got very tight again and I started having pins and needles in my vulva. And that went right back to tight muscles squeezing nerves. So have you had a pelvic floor assessment? I would want to know the health of your muscles down there. My hot pipe, my hot button for my vulvodynia was my perineum. And let me get my model here. Hold on. Oh. So take all the bits out. If only hysterectomies were as easy as me just removing it like that. Okay. Enter proper anatomy. Here is your pelvis, correct? And remember that the way the human body is built, the bigger the bone, the more weight it's meant to carry. It's your biggest bones by surface area are your hip bones because they're meant to carry the weight of your torso, correct? Now, inside your pelvis, We have all of your organs. We have got giant blood vessels that deliver blood down your legs. We've got giant nerves. The pudendal nerve is a really big nerve. And of course, we have skeletal muscles. And these are the muscles, your pelvic floor muscles, that help you open and close your legs. They help you move. These are physically activity dependent muscles. These are the muscles that help you move your body. Okay? The interesting thing about these muscles is that they're flat. These are the muscles in the correct position. And you can see that they go along the bone. If I stick my finger in my vagina, these are the muscles that I'm going to be touching. Deep muscles, mid-level muscles, and shallow muscles. A pelvic floor muscle feels like a raw chicken breast. It's soft, it's pliant. You can move it. You know, I did a surgical internship when I got my pharmacology degree, so I did surgery on animals for a year. And I was always fascinated by the fact that I could make a little tiny incision, like this big, a centimeter, through muscle. And I never lost an animal, you guys. I was a good surgeon. I could make a little tiny incision, and I could, just using my forceps, I could stretch it this wide just by gently massaging that muscle and getting it to release, right? So muscle should be soft and pliant. A hard muscle feels like painful beef jerky, right? So what's so interesting about the pelvis is it has 3 layers of muscles. So they line up with your knuckles. So if I stick my finger in here, okay, our deepest muscle is right back here by the sacrum, your piriformis muscle. We also have shallow muscles. We also have mid-level muscles, and then we have shallow muscles. So the shallow muscles are on the surface. And yes, my model is broken. The other part of the vulva is underneath my desk, way over in the corner, and I can't get to it. Okay. So these are the shallowest muscles. These are the muscles that have holes in the middle of them. They've got a hole to allow you to urinate. They've got a hole for your vagina, and they've got a hole for your rectum. So what makes the pelvic floor muscles so incredibly important to human function is that they're the only skeletal muscles that control major bodily functions. So if your muscles are tight, your levator muscles are tight, they're going to squeeze your urethra. That's just going to feel hard to pee. It's going to feel like you're trying to pee through a needle. We call that a urethral stricture. If you have tight muscles, it's going to make it hard for you to have sex. It's going to make it hard for a penis to go in your vagina, right? If you have tight muscles around your rectum, you're going to have rectal pain. In fact, that's what I feel more. If my muscles are starting to get tight, I get rectal pain. But I know what to do. I go get my wand. I massage my muscles on the internally, and they go away. But here's the thing. When I had vulvodynia in high school, you know what my hot point was? Right here, the perineum, that skin between the vagina and the rectum. Damn it, that hurt. It was like somebody cut the skin off with a scalpel or taken it off with sandpaper. Every single time this hurt. And I'm thinking skin, vulva, 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 right? No, guess what? You know who explained that vulvodynia pain? Jerome Weiss in this book. You know what's immediately under the vulva, the perineum? Muscle. Right there. That's actually an attachment point for 4 muscles. Right there, where my pain was the worst. So all that time, I had that perineal pain that I thought was vulvodynia. It was never vulvodynia. It was always what we call the perineal body. And I'm going to show you a good picture of it. Okay. So if you look at this picture, here we have the rectum, here we have the vagina, and here we have the urethra. You see that little knob right there? See that little knob? Yeah, that's called the perineal body. So, Chi-Chi, have you had a pelvic floor assessment, girl? This book is the Bible for pelvic floor. IC 101 is the Bible for all the subtypes. And that book is right here. If you don't have this book yet, get this book. This is the book that will introduce you into subtypes. It will introduce you into all that. That book is for the pelvic floor subtype. This book is for all the subtypes, okay? IC 101 versus breaking through chronic pelvic pain. Jeannie said, "It's a medicine Detrol, the same as oxybutynin?" Basically, yes. It's not exactly the same medication, but it's very similar. Those are both anticholinergics. Myrbetrix is not an anticholinergic. Denise says, "I have estrogen atrophy. You take estradiol 3 times a week. Now I started to do it twice a week, and I'm flaring. You have a lot of pressure and pain. I'm on it about 2 years and was doing really good. Do you think it could be that I decreased it? I get so frightened when this happens." I don't know, hon. You're going to have to talk to your doctor about that. I've never interpreted estrogen atrophy as pressure. Pressure, and to be quite honest, I've really never had the symptom of pressure because I've never really been a bladder wall patient. I am a pelvic floor central sensitization patient. So I don't know, hun. I mean, you could ask your doctor if you could go back to 3 times a week and see if it goes away. And if it does, then you know. Chloe said, "What's the name of the test for the bacteria?" Microgen. 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 Missy said, "Is Vulvacare as good as V-Magic?" I don't know, hun. I don't know. Let me look at it. I mean, Vulvacare cream. Let me look at it real quick. It's a vulva balm cream. Oh, that's a lot of reviews. Let's see if it'll tell us the ingredients. It's always nice to have the extra virgin olive oil, avocado oil, buckthorn oil. It's like literally a copy of V-Magic. Exact same thing. Same exact ingredients in V-Magic. I wonder how that happened. It's always frustrating when you go out of your way to really create a really, really good product and then bam, somebody else copies it. But we've sold V-Magic for 15 years very, very successfully. Never had a complaint about it. Denise said, "What's the spelling on the amitriptyline?" Myrbetrix. Chi-Chi said it's more of a pudendal nerve burning sensation. So again, if it's a pudendal nerve sensation, then you have to figure out why is the nerve being tweaked. The nerve is being tweaked by tight muscles. So you still have to do physical therapy because we have to release the pressure on the nerve that's causing the pudendal neuralgia. But at the same time, they might also give you something that will help calm nerves down, like a lidocaine cream. Here, hold on a sec. Did you need something? Yeah. You guys, would you mind waiting a minute or two? My mother has had a bathroom incident. I will be right back. Okay. All right. Yeah. Okay, let's go in there and we'll fix it up. A big one or a little one? I'll be right back. Okay, move it up here. All right. Put your arm, the right arm here, that arm on the door, and we're going to go into the bathroom. All right? It's okay. I got you. No, Mom. This arm is going to go here. I got you. You're not going to fall. I'll walk all the way by the toilet. You did a pretty good job. What was that, Dad? Freezing. Freezing. Okay, you're drying out. You are good. You did a good job overall. Okay? Okay. Check the furnace. All right. All right, I'm back. Sorry about that. Here's the deal. My life Caring for elderly parents is about peeing and pooping. And my mom can't use her fingers anymore, so she can't wipe. So, you know, it is what it is. All right, let me just brush my hair here and work myself back up. Time for a ponytail. Deep breath. Chi says, for rectal pain, I do a suppository for 10 milligrams of Valium and 25 ml ketamine. Yeah, but Chi, are you doing physical therapy? I mean, you're doing a lot of treatments. Oh, you had a hysterectomy the same year I had a hysterectomy in 2017. Hysterectomies are brutal on the pelvic floor. Did I get it right? You know, I mean, Chi, you got to do what you got to do. I would really encourage you. This is a really important book for you because the piece that you're missing in this whole thing is the nerve pathways. And I wanted to see if I could, like, I was shocked when, so after I had my hysterectomy, man, my pelvic floor spasmed for almost a year. It was shocking how bad it was. And so went to physical therapy, got it calmed down. And then a couple of years ago, I started getting this pin pricking sensation on my vulva. And it got worse. And my whole vulva was like I was being poked by needles randomly over on the left and on the right, low, high. It was all over the place. And to make a very long story short, it was pelvic floor tension. I did not realize that that pudendal neuralgia could manifest as vulvodynia and cause pinpricking in the vulva. And the pelvic pain specialist sent me back to physical therapy, but she also gave me topical estrogen combined with lidocaine to silence the nerves on my vulva. But it was the physical therapy in the end that was so important. So here we go. Here we go. Here we go. Here's a section on vulvodynia. Hold on. Let me just read this. So, okay. Treating vulvodynia holistically. And he's got 6 potential causes: tight muscles, pudendal neuralgia, subcutaneous tissue sensitivity and restriction like scar tissue, vulvar tissue sensitivity, again, nerve sensitizations, central sensitization. So link number 1, dysfunctional pelvic floor muscles. In my opinion, the failure to effectively rehabilitate dysfunctional pelvic floor muscles has historically been the crucial missing link in the treatment of all subsets of vulvodynia. This is because these muscles can be either the primary source of chronic vulvar pain or a secondary source. As explained previously, the skin around the vulva and the muscles of the pelvic floor are in communication with the spinal cord. Thus, it would follow that pelvic floor muscle injuries can sensitize vulvar skin, in which case the muscles would be considered the primary source of vulvar pain. For example, in the case of primary vulvodynia, in which vulvar pain is present from the first tampon insertion or attempt at intercourse, it is very common to elicit a history of a tailbone injury, usually caused by a fall at a young age. An injury to this major attachment point for the pelvic floor muscles can result in asymptomatic trigger points and increased muscle tension that remains dormant for years. Symptoms only develop when the vulva and the surrounding muscle groups are subjected to further stresses, at which point the initial stressor, the tailbone injury, is likely to be long forgotten. Pelvic floor muscle injury in childhood from falls, athletic activities, chronic constipation, bicycle, horseback riding, ballet, gymnastic training, sexual abuse, chronic emotional stress can sensitize vulvar tissues. Secondary vulvodynia, which occurs after months or years of tampon use or painless sexual intercourse, may also be the result of a series of pelvic floor traumas that have caused muscles to exceed their limit of tension and initiate the vulvodynia cycle. Increased muscle tension and trigger points can be the additive result of falls, pelvic surgeries, hello hysterectomy, childbirth, local injuries, and emotional stress from which you tighten muscles. But the process can also go in the reverse direction, whereby inflammation from the vaginal infection, allergies, or skin sensitivity can create tension in the underlying muscles. All right. After vulvar symptoms have been successfully treated or subside spontaneously, underlying pelvic floor muscles may remain dysfunctional and maintain vulvodynia by engaging the central nervous system in a vicious pain perpetuating cycle of central sensitization. This may explain why yeast and other vaginal infections often precede vulvodynia, and yet research, anyway, let me get to a patient story for you, Chichi. Teresa was 32 years old with a 5-year history of painful intercourse. 2 years prior to the onset of vulvar pain, she began to suffer from bladder infections with sex. When the antibiotics prescribed for the problem not only failed to solve it, but also caused vaginal yeast infection, she was further distressed. Hoping to find a specialist who could pull her out of her misery, she consulted a urologist who recommended examining the bladder and urethra with a cystoscope. Unfortunately, Teresa's urinary sphincter muscle was so tight from all of her infections that the cystoscope could not be inserted without some force. The result of this very traumatic and painful procedure was an escalation of her vaginal pain that became so severe she was no longer able to have intercourse. This prompted her physicians to try a wide variety of treatments, including oral amitriptyline, Neurontin, a topical mixture of lidocaine, estrace vaginal cream, allergy drops, and external physical therapy. When none of these provided any relief, she consulted me, and that's Dr. Jerome Wise. My examination produced a host of significant findings, including textbook examples of pelvic floor trigger points and areas of subcutaneous tissue sensitivity that are typically associated with vulvar pain. There is also marked sensitivity of the tissues around the vaginal opening when I touch them with a cotton swab, and the pudendal nerves that supply vulvar tissues were very tender to touch, indicating a pudendal nerve injury, irritation, or injury. Teresa's bladder infections have started the pain ball rolling by causing the pelvic floor muscles to tighten in response to recurrent inflammation. The vaginal yeast infections resulted in further muscle spasms that culminated in the development of asymptomatic trigger points. The tight, dysfunctional muscles were now an accident waiting to happen. The final blow was a very traumatic cystoscopy that sent them into an intense spasm, preventing intercourse, activating pelvic floor trigger points, and compressing the pudendal nerve. And furthermore, 5 years of constant painful stimuli had sensitized the central nervous system. Our treatment regimen addressed every level of Teresa's problem, beginning with tissue sensitivity and irritation. She continued the Neurontin to calm her distressed nervous system, and a lidoterm anesthetic patch was used nightly at the vaginal opening to desensitize the nerve endings there. The vulvar tissues were protected from irritating secretions with regular applications of coconut oil, and symptomatic relief from itching was achieved with topical applications of doxepin. Concurrently, I administered internal pelvic floor myofascial release to eradicate the trigger points, lengthen contracted muscles, and mobilize the sensitized pudendal nerve. Subcutaneous tissue manipulation was also performed to reverse restrictions and tenderness in the areas of the buttocks, pubis, and inner thighs. After 8 months of treatment, she was finally able to have sex without pain. However, there were occasional flares of low-grade intensity attributed to the reactivation of trigger points in the pubovaginalis muscles around the vaginal opening and in the piriformis muscles that rotate the hips. These problems were successfully treated with dry needling. As with most vulvodynia patients, Teresa's symptoms occasionally reappear, usually due to emotional stress or activities that strain the pelvic floor muscles. Muscle, muscle, muscle. And Kayleen says, for my vulvodynia is at 8 to 11 o'clock on my left side. when my physical therapist actually did internal work, she was able to trigger my hip muscle and it would make my hip feel better. She made me touch my left cheek, and that was really tight too. And she wants to get better so badly. Chi Chi says she's been in a lot of pain since 2012, so it will never get better. Honey, Chi Chi, girl, listen. I had severe, severe vulvodynia pain when I was in high school. I graduated high school in 1978. Um, and it got better eventually once we found the underlying problem. And the underlying problem ultimately was a broken tailbone that tweaked the muscles. And then, as he said, it's injury. It's like injury that builds on injury, injury, injury. In the end, the long-term toll of tight pelvic floor muscles is oxygen deprivation. It's restricting blood supply. And so we always have to work on those muscles to really get good blood supply to the vulva and to really help that tissue heal. So don't you dare give up, hon. Remember, I had a doctor say to me, you will forever be a burden on your family. You will always live with severe pain. And that was the day I started fighting back. And he was wrong because I don't live with that pain anymore. And Don says finding a more skilled physical therapist would help. I had to have 5 or 6 different trained PTs and not all well trained. Chichi said, I had 7 surgeries for vulvodynia. They took most of my tissue out, but I still have tissue that burns when I have a flare up by yeast or a lot of good bacteria. Honey, I'm so sorry that you're going through that. It's just no man can understand the trauma and the pain that you have gone through with vulvodynia and with your surgery. I'm so sorry. And I would love to say it should have never happened, but when you were going through this and when I was going through this, they didn't know about a lot of this. They just didn't. But we're learning. We're learning. We're getting better at understanding underlying causation. Chichi, have you tried PEA, Peora? Because PEA, the general consensus among the researchers is it's really good at calming nerves down, neuropathic pain, and it's over the counter, no side effects in the IC study. It's what I take every night. And I'm just trying to keep my nervous system as calm as I can. And it's been, I'm thrilled with it myself. I don't like taking anything, but my skin was so sensitive. I was having trouble sleeping, and now my skin is normal. So Hadar said, how are there people without glomerations, but there's people with glomerations? Why is it not a factor anymore? Because Hadar, they have connected the glomerations to the test. Oh, you're taking it daily? Has it helped at all, honey? Has it helped at all? I hope so. So, Hadar, glomerations are the result of having your bladder stretched. If they use, and it depends upon the health of your bladder. So let's just say you're older and you have a smaller bladder that's estrogen atrophied and they try to stretch your bladder, a lot of it's going to rip and you're going to have a lot of glomerations. Whereas you take somebody younger who's not in estrogen atrophy, their bladder is not going to tear as much. But glomerations are not unique to IC. Glomerations happen in anybody who gets their bladder stretched. And that happened in 1987 when our government, in their first diagnostic guidelines for IC for research studies, they put in you can admit somebody to an IC study if they have glomerations. And this other doctor went not so fast, and he did a study, and he took women who were scheduled for a tubal ligation who had no bladder symptoms, did the hydrodistension, and guess what? They got glomerations. It's the test. It says nothing about the skin. And that's why it's thrown out. Hi, Paula. Does anybody want to go into Zoom? If anybody have any questions, if you want, I can set up the Zoom meeting. Mary says, it amazes me the lack of knowledge so many doctors have regarding the pudendal nerve. It makes so much sense to me when I looked at the pelvic back, how it entwines with everything down there. Yeah. And one of the things that Dr. Weiss says in that book is he believes that a lot of patients have nerve problems. You know, one of the things when he did his diagnostic workup of patients with pelvic pain and IC and vulvodynia is he didn't just look internally, he also looked cutaneously underneath the skin, right? And so if I do this, right, directly under the skin is a cutaneous layer. And there are nerves in there too. And so he found some patients had pain just immediately under the skin. And so he used lidocaine on the outside of the skin, and sometimes he injected lidocaine immediately under the skin. So what's under the skin that can become sensitive could be something like scar tissue. So the nerves are plentiful in the pelvis because hello, there's a lot of stuff down there that needs to be innervated. So you've got nerves that come off the spinal cord, right? And then L4, L5, and they also come out through the sacrum, and they merge together, and then they spread apart, and then they innervate everything down there. I wanted to see if I can, but like Kayleen's saying she has pain on the left side, so that tells you that she has a structural problem on the left side involving nerves and muscles. That's not her bladder at all. That is absolutely pelvic floor. Anytime you have pain that's isolated on one side or the other, that's not your bladder. Kristen, hi Kristen. How does pelvic mesh affect bladder and bowel function? I've had to have 5 mesh revision surgeries and I've seen no improvement in pain levels or function. Man, Kristen, this is a hot topic. We have had every meeting. We have patients who come in who ask very, very similar questions. And you've had 5 surgeries. Wow. On mesh, I was actually at the first urology conference where they brought in the first research study that showed that there were problems with mesh. And so let me just try to give context here. After childbirth or with aging, the muscles in women tend to weaken, and you can develop something called a prolapse. And some women who have children, the age of 19, 20, or 21, they suffer a catastrophic muscle injury, and now their organs are falling out of place. And it's the greatest gift that a woman can give a man is to risk her life to bear his child. Bearing children can be deadly. Bearing children is not always easy. It can take a toll on the female body, and it can take a toll on muscles and a toll on nerves. And so it is a reality that muscles weaken with time, with age, and after injury. And unfortunately, in the pelvis, those muscles that normally kind of anchor structures are now weak enough that structures start to move, like your bladder or your vagina. Think about a hernia. A hernia is an area of bowel that pokes through muscle because there's a hole in the muscle where there shouldn't be. So repairing those has always been a challenge. And years ago, somebody came up with this concept of a polypropylene mesh. And it's a plastic mesh. So think about a window screen, little squares, right? And they could use this mesh and kind of anchor up tissue and reattach it and get stuff to the. And Kristen says here, yes, I had a big headed baby breech. Of course, I've never been the same. Exactly. So we have basically muscles that are completely stretched out. Their physical therapy, a Kegel is not going to repair these muscles. Surgery is, at that point in time, going to be an option or a pessary. So this mesh surgery was originally met with great optimism, great optimism. Um, but interestingly, the American company that they bought the mesh from, stopped selling it to the pharmaceutical company and said, hey, this is never meant to go inside the human body. So what happened with the mesh is that it started to migrate. So tissue basically went through the holes in the mesh. So now we've got this plastic boat, for lack of a better term, that's in the pelvis, and it moves. And so mesh has been known to migrate through the vaginal wall. And Kristen says here, my immune system has reacted strongly to the plastic in my pelvis. Yeah, I mean, it's really, Kristen, there's a great documentary, I think done on Frontline, that is just, will infuriate you, and it should, because it should never have gotten to the point that it did. Okay, so anyway, so shortly after they started using mesh, they had reports of mesh moving, and it would migrate through tissue. So if you were having sex with your husband, all of a sudden your husband would go, hey, there's a rough area here. What is this? Stick your finger in there. Oh, it's mesh. It's mesh. And in more severe cases, mesh actually cut through the urethra. Like, I mean, really brutal. So doctors fairly quickly saw that there was a problem, but they weren't necessarily understanding what the problem was. And so at the AUA conference that I was at, what was interesting is they took mesh samples and they tested it for infection. And the mesh was filled with infection, lots of different types of bacteria. So that was like a whole nother story. So now not only do we have the immune reaction to the plastic, we've got the plastic moving. Now we know that the plastic harbors infection. Well, the patients were crying out, help us, help us, help us. Company was in denial. The company, I think, was making a lot of money. And when they got cut off from their mesh supplier here in the US, they went to China. And they found a mesh supplier in China. And and they bought like 100-year supply or 50-year supply of mesh. But here's the thing, they couldn't import it to the United States with the labels. They actually had to lie on their import labels about what they were calling it and why they were bringing it in to get here to the United States. And when they brought the Chinese mesh to the United States and they did the same safety testing, it was not as good. There were problems with it. And this is all part of the mesh litigation. So hundreds of thousands of women have had mesh, and I don't know the number of patients who have had mesh complications, but probably the majority of them have had devastating complications, as Kristen has. So Kristen, plastic, as that original manufacturer said, does not belong in the human body. Getting it out is hard because now you've got the tissue going in and out of the mesh. And she has had 5 surgeries now to try to get rid of the plastic. And honey, I'm so angry on your behalf and sorry that you have gone through this stress and agony. And it all goes right back to the company, and the company not listening to the guys who originally created it. And I truly hope you're part of the class action lawsuits, because you, in my opinion, deserve compensation. So, yeah, and you have chronic infection in your exactly. This is a journey. This is a journey. You're doing everything right. You're doing everything that you can to get better. You've had as much of it excised as you can. And I think that aside from the immune response that's going on, all those surgeries have caused a lot of scar tissue, a lot of muscle stuff. You had muscle stuff going on anyway. So I would be in pelvic floor physical therapy or working with a pelvic floor specialist or a pelvic pain specialist for that. I would be working on calming nerves down and calming the nerves down with something like Peora. This is, and Don, ironically, on Facebook just said, "What brand do you recommend?" This is the brand that I take, PEA, Peora Poly 500. And this is made by Natural Approach Nutrition. And this is a very close match to the formula used in the IC study. Christian says, "Thank you. The doctor that did this to me is also a wicked witch." Oh, well, they're in denial too. It's very hard for them to admit that they did something. See, here's the thing. This is kind of like the opiate problem. The company is telling the doctors it's safe, and the doctors believe them, and the doctors tell you it's safe. So then when patients start reporting problems, they go to the doctor, and the doctor almost immediately it's going to say, wasn't anything I did. Maybe you have a ruptured disc in your back. There's always going to be a level of denial. It's kind of like with all the dental work I've had to have. It's deny, deny, deny. No, it happened after she cleaned my teeth and broke the roots. So it's instinctive almost for them to say, I don't think it was a mesh. Then, you go home, you're suffering, you're not getting the pain care you need, you're crying, you're looking for help. And Kristen said, yeah, she pulled on my mesh in the office and tore it from my scar tissue. Oh my God. Oh my God. Did you have any anesthetic? Was there any anesthesia going on there at all? Oh, it gives me chills just thinking about what that must have felt like, girl. Oh my God. So you're going to have to do everything you can to get your muscles as healthy as you can, get your nerves as healthy as you can. You're going to have to protect your pelvis. You're never going to be a bike rider. You're never going to be a horseback rider. Probably anything that's going to put pressure on your crotch is off the table for you. We've got to wait and see research. There's a lot of research studies that keep coming down the pipe on this. Let me just take a look and see what I can find for you. I'm going to go to the National Library of Medicine. Then she then said, "Did that hurt? No anesthesia?" Oh. Let me just see. God, there's so much research on this. Here, hold on. I gotta sort this by date. Most recent date. Let's see here. Vaginoscopy with laser treatment of symptomatic upper vaginal mesh exposure after prior mesh sacrocolpoplexy. So much. So this is a study. It's published this month. Vaginal laparoscopic suburethral sling explantation to describe the different laparoscopic and vaginal steps of suburethral infected meth explantation, as well as unexpected and unusual complication. A submucosal calcification on the suburethral segment of the sling. Yikes. Okay. Oh, Kristen, I would love to help you if I could. What state do you live in? Just out of curiosity. I mean, I think that it would be really reasonable for you to go see a true pelvic pain expert, somebody like Robert Eckenberg in Pennsylvania, who can give you a completely neutral assessment of pain generators in your pelvis. Because it's hard to, we have to try to figure out what. Oh my God, you're in Pennsylvania. Well, there you go. That's fantastic. Let me here. She's on YouTube. Let me. I'm going to write his name down for you. Um, Robert Eckenberg. He's in Bethlehem, Pennsylvania. He is, in my opinion, the best pelvic pain doctor in the country. He has a really big survey that you fill out before you go for your first appointment, and I truly think you need to see somebody like him. But I also think you need to get this book, and you need to read this book, because I need you to understand your anatomy better than your doctors at this point in time. You need to know where the nerves are located, where the muscles are located, where your mesh was located, and everything that's affecting that specific area. Oh my God, he's only an hour away from you. Hey, that's great. He's a sweetie pie. He's a really, really nice doctor. He's and his career now is dedicated to training other doctors about pelvic pain disorders. And you are the epitome of a pelvic pain patient. You are a surgical pelvic pain patient. But ultimately, in the end, we have to go back to trying to understand your anatomy. Something happened when you had your breech baby. There's no doubt about that. Muscles were torn. So we need to understand the health of those muscles. We need to understand the health of the nerves and the skin. How old are you, hon? Kristen, how old are you? Like, are you in your 30s? How old are you? Google him. Google him. Go to his website. He's really, really good. I don't know if you need some topical estrogen to try to make your skin a little bit stronger. Estrogen might help strengthen your muscles a little bit. I don't know if physical therapy is appropriate or if it's not. Okay, so girl, listen, we're very close in age. So the other thing that's absolutely going on with you, she's 59 years old, is you are in estrogen atrophy, hon. Absolutely in estrogen atrophy. You haven't had a period in years. So that's going to change everything too, because now your skin is drier and your muscles are weaker, because the loss of estrogen makes muscles a bit weaker and it makes skin drier. And so that's also going to be playing a role. And to try to keep that skin as healthy as possible using that topical estrogen might be what Dr. Eckenberg would suggest. Okay, good. You've had a journey, and I'm so sorry that you've gone through that. And I really hope you're part of the clinical trial. I mean, part of the class action lawsuit. I think that, and you got to find that documentary on mesh. It was either 60 Minutes or Frontline or Nova. And when you had your hysterectomy when you were 44, okay, so that also is going to tweak your pelvic floor big time. Yeah, and platelet-rich plasma. So hold on, somebody else came in and said they'd done. Okay, Kata says, I had platelet-rich plasma injections for vulva on Monday for lichen sclerosis, which causes me pain in the vulva and the bladder. Your skin is already better. You're going for a repeat treatment. Hey, girl, thank you for sharing. That's really helpful. That's really, really helpful. Platelet-rich plasma It's kind of like hyperbaric oxygen therapy in the sense that they're both providing healing generators to tissue. In one case, plasma, and hyperbaric just forces a lot of oxygen into the blood. And Christian, hyperbaric oxygen therapy might be helpful too. Good. I'm glad you're seeking, Justin. And I agree with Kata. I would be looking a little bit more at platelet-rich plasma. And I don't know if they've done that with mesh, but there are hundreds of studies now. And I think that you're going to have to do a lot of research. Audrey says, can menopause trigger improved symptoms with IC? Absolutely. Absolutely. It's called the genitourinary syndrome of menopause. This is bladder pain syndrome subtype 2, bladder wall driven. Remember, we're subtyping now. Not everybody's the same, right? And so we have to try to find your underlying cause. And for many women, it's birth control, Lupron, or perimenopause or menopause. Think about your bladder for a moment. It's the only organ in the human body designed to hold toxic waste because urine contains ammonia and urea and all sorts of irritants. So how can the bladder hold ammonia for hours at a time and not get damaged? It's really an evolutionary marvel. God knows what our bladders are going to look like in 10,000 years. They're going to be tanks, because we have so many chemicals right now. Okay, but anyway, how does the bladder hold acids and ammonia and urea for hours at a time? Well, it turns out your bladder's like your mouth. It's a hollow organ with a really thick, wet coating of mucus. It's wet. Your bladder is wet. Your urethra is wet. Your vulva is wet. Your vagina is wet. And your mouth is wet. These are mucous membrane organs. The bladder and the urethra, the vulva and the vagina are part called the urogenital sinus. They're actually connected. They were the same cell. I mean, they were in the same cell group that diversified when we were little tiny mini babies, right? So there are a lot of estrogen receptors in the bladder, and estrogen plays a critical role in the production of mucus. So when you're young and you have lots of estrogen, you have lots of mucus. Once you're in perimenopause, or you go on birth control, or you use Lupron, girl, you are not, and you do not have the estrogen anymore. Therefore, you do not have the mucus anymore. Therefore, your bladder's ability to defend itself is now compromised. It's compromised. And so that cup of coffee or soda you enjoyed in your 40s, all of a sudden in your 50s hurts. That's not a disease. There's no disease happening. That's just dryness. And therapeutically, our priority is to try to restore mucus. How do we do that? We give the skin estrogen. Think about a raisin. When you put a raisin in water, what does it do? It plumps up. When you give a dry skin cell estrogen, it plumps up and starts to produce mucus. You know what, guys? I got to take my flipper out. Hold on. Remember, I know this is weird, but I've had bone grafts, so. Relief. You can't see it. I'm missing 2 teeth right here. Oh, that feels so much better. Okay, I'm just not going to turn my head that way. Show you the gaping hole in my mouth. Kristen said, I wanted to try hyperbaric. I didn't know about platelet-rich plasma, but I'm going to study it now. Good. Audrey said, okay, so Audrey, yes. It's called genitourinary syndrome of menopause. Frequency, urgency, pressure, pain. There's no disease. It's just estrogen atrophy. Dry mouth hurts. Dry bladder hurts. Dry urethra hurts. The urethra is kind of the canary in the coal mine. It's a urethra that's the first part of the urinary tract that's going to start to scream with the lots of estrogen. So I'm building a website on this called womenwithgsm.org, but it's not done, so it's not active yet because I've had other stuff to do. So no disease happening. It's just dryness. Hi, Sue. Sue's wondering if we got any of the horrible weather. Oh, listen, the weather's been horrible, and we're having 6 days of rain. And we're going to have an even bigger storm Monday night than with the one we just had. The flooding is insane. I live on a hill. That's one thing my parents taught me is never live on a valley floor near a river. I live on a hill, so the only thing we have to worry about are mudslides. And we do get mudslides occasionally, so knock on wood. Um, let's see. So next week is going to be and snow melt. Oh man, there's going to be a lot of flooding. Remember, the Central Valley, which grows so much of the food for the United States, was once the biggest freshwater lake in the world. And then an earthquake happened, broke part of it off. It couldn't drain. And then mankind has slowly been converting that area to farmland. It's still a lake. And all that snow melt's going to go somewhere. And it's going to be interesting. I don't know if it was the biggest freshwater lake in the world or in the U.S. I thought it was in the world. The Central Valley of the U.S. was huge. Is any mesh in your pelvic area bad? Because I did have mesh to put in my rectocele and to hold up my bladder. No, there are different types of mesh. Some mesh is better than the other. So it's a lot of the older mesh, the early mesh that they used is the risky mesh. Sue says, I wanted natural tissue when I had my hysterectomy, and the doctor said he recommended the mesh and would recommend it to his mother. I have to pay now. I have more pay now than I did before that surgery, but I didn't know what was causing it. Chloe said there's a very good documentary on Netflix about medical interventions that covered the terrible effects of mesh. Yeah, the documentaries have been great. And Sue said the estrogen stopped the feeling of having a little urine left and that burn after I started using it. Sue, exact same thing to me. When my urethra got dry, it felt like there was a drop of urine stuck in my urethra that would not come out, and it was constant, just constant. And 10 days on estrogen and it was gone. And if I don't use my estrogen for 2 weeks, my urethra starts to get irritated and my skin starts to get dry again. So I'm very personally invested in wanting to keep using my topical estrogen. Oh. Are there any dentists out there? Why do bone grafts hurt 3 weeks later? I mean, it's not terrible. It's not terrible. It's just there. It's like an ache. And the more I talk, it's like the air goes over the skin, over the bone graft, and it just gets annoyed. All right. So I'll make this offer one more time. If anybody wants to go into Zoom, we can go into Zoom. Otherwise, I think we're probably at a natural end for this meeting. So let me do, Mary says, the nerves in my mouth. Exactly. And I know. Because the pain can shoot across my front teeth. It's either in the back tooth or the eye tooth, or it shoots this way. I hate dental pain. I have so much trauma over dental pain over the years. You guys know that I've shared this story. I had a tooth fracture in college, and I had an emergency root canal by a doctor who was arrested the next day for doing cocaine and dealing cocaine out of his office. It was a Saturday appointment. Nobody else was there. I was desperate. It took him 8 hours to do a root canal. Every 15 minutes, he got up and went into his office for 5 minutes, and he was snorting cocaine. And it was this tooth, which is now an implant and a crown. And Sue says, you may have bone spurs that are working their way out. I had that happen for almost 2 years after losing tooth. Honestly, I felt like there was something a little sharp in there. I did. Sue, I did. I've had a couple of pieces come out, so that's possible. Mary says, awful doctor. Yeah, he was arrested, prosecuted, convicted, and it didn't dawn on me to sue him. I mean, I should have sued him. I was his last appointment before he got arrested. And the trauma, the PTSD from that appointment is real. And so and throw in the fact that my dentist, when I was a kid, hollowed out all my molars and put silver in them, and they all cracked. So Michelle says, I paid for a coaching appointment, but not sure how to schedule. If you can help me. Well, Michelle, we can do it right now if you want. I mean, it's 4 o'clock. I'm happy to do it right now after the meeting, or Mondays are normally my day off. We can go for Tuesday if you want, sometime this week. Um, Wednesday, I have appointments all day Wednesday, pretty much, but I'm open Tuesday, Thursday, and Friday. But honey, I'm happy to call you tonight if you want to talk. You're at the gym, okay? So I'm going to give you my direct line. That's my direct line. 707-538-9442. Anybody can call that. Why don't you call me on Tuesday? And my staff normally send me emails with people who signed up for coaching so that I can reach out to them. But I couldn't do a lot last week because our phones were out because of the storm. My landlines go out. They just go out. It's impossible to talk on them during storms. I just put it in there. I'll put it in again. Okay, so that's a direct line to the IC network, to my office here at the IC network. So you call me, but just know we're expecting another huge storm Monday night, Tuesday. Landlines are going to be out. I cannot put my cell phone live, but if you call and leave a message, I should be able to listen to my messages, and then I will call you on my cell phone since the landlines won't work. Okay? Linda says, do I take insurance or it's a fee? Okay. So here's the deal. If you just have a couple questions on IC, you can call me at that number, and I'm happy to talk to you. Absolutely no charge. Okay? Absolutely no charge. And I worked, like I said, I worked with somebody for 2 hours the other night. She was crying. I wanted to help. No charge. I'm a support group leader. That's what I do. But if you want to spend a lot of time talking, and if you can afford it, it would be great if you could sign up for a coaching, because I think my time is valuable. And so it's $50 for 30 minutes or $100 for an hour. But again, 95% of the coaching I do, it's just free. But I really appreciate it when patients can pay for the coaching, because I have bills that I have to pay, and I hope the people see value in what I have to say, if that makes sense. Amy says, do you get every donation I made? Did I get the donation you made a couple of weeks ago? You should have gotten a thank you letter from Heather, and she signs for me, but sometimes I can send them out and sometimes I can't. And I've had all the dental catastrophe. Let me take a look. But you should have gotten a thank you like right away. So hold on a sec. Let me log in. Well, I'm going to fix that. I'm going to make sure that you do. Yes, I see it right here. Oh, well, yeah. Okay. So it was made on the 22nd. Amy, thank you so much. We really, really, really appreciate it. I'm going to print this out right now. Oh, I'm not on the right internet to print. Okay, hold on. Girl, you're going to get a thank you from me personally. Thank you so much. I'm just going to leave that right here so that I will do it. I don't know. It may just have been a little bit too soon. I'm not sure how behind. We've been very behind because of all the storms. So Oh, Amy, honey, that was plenty. Thank you. Thank you so much. Sue says they can remove those bone spurs if they inflame your guns too much, if you can feel them. Yeah, I definitely felt something sticking out of the gum. Definitely. Michelle says, you would not believe what some people are trying to charge. I have followed you for years and you are the guru. You know, I want to talk about that a little bit. I mean, listen, everybody has to make a living. And when I started the IC network, we were not welcomed. You have to understand that nonprofits are very territorial. Doesn't matter what field you're in. If you try to set up something in a specific area that there's already a nonprofit serving it, the odds are you're not going to be welcomed to that degree. And when I pitched the idea of building an online support group to the ICA for my doctoral dissertation, I was laughed at. No, flat out laughed at. I was given a lecture on knowing my place, and I was told what a stupid idea it was to build an online internet support forum. I gave them a year's worth of data, and I was laughed at. And I said, okay, if you don't want to do it, that's fine. I want to do it because I'd like to get my degree. And I was told, we will never, ever acknowledge your work if you do it. Okay? We will never, ever. That's a direct quote. We will never, ever acknowledge your work if you do it. But I just felt so strongly that there were so many patients who were homebound like me, who needed support. And, I just had a hunch, so I started the support groups on AOL, the urology support works, worked with paraplegics, quadriplegics, infection patients, chemo patients, cancer patients, IC patients, worked with all of them. Did my data for a year. I found a dissertation at Stanford on how to bring support to patients who were homebound. I applied that to IC, pitched it, got yelled at. And that's the moment the IC network was born. That was the moment that the IC network was born. Now, for 5 years, I paid for everything. I didn't have a lot of money, but that's when it was $100 a month to be online anyway. And I knew that I had the skills. I had the background. I had the degrees. I knew, and I had the experience. I'd already been a nonprofit board member. I'd already raised millions of dollars for nonprofits. I knew what to do. And so I built what I thought was going to be the next nonprofit on IC. But then I ran out of money, and I did a nonprofit fund development assessment to see if there was any money. And there was none. There was none. And the ICA had the few grants locked up. There would be no money for a new nonprofit. And so I was literally with my local support group that I ran, in this group, going, what the hell do? We can't build another nonprofit. We already know it's hostile as hell. What should we do? I said, I can't keep paying for it. I mean, I have no money. And somebody said, well, you're an educator. Create an education and publishing company. And I was like, the light bulb went on. Oh, wait. God, now that's a really, really good idea. So that's exactly how we organize the IC network. And that's exactly why we're as successful as we are. I mean, we're rated number one. We've been rated number one in 2 peer-reviewed studies, one by Harvard and the other by the University of London. My little doctoral dissertation proposal, because I didn't even get to the doctorate because I was in too much pain. But my little proposal, 30 years later, it's been rated number one by Harvard. Okay, I'm published by Harvard now for my IC work without a PhD. So I'm very grateful for that. Okay, so anyway, so we organized as a health education company, but the powers that be were clearly not happy with me. And so they told people not to come to the IC network because I was profiting off a patient. And my answer was, where? It's free. The website is free. I'm a terrible businesswoman giving it away, right? this was before Facebook. I had 200,000 patients a month using my website for free. If I had charged them $5 a month, I would have been bringing in $1 million a month. I would have had a retirement fund. But it was always, don't trust her. She's profiting off of patients. And I even had a doctor, a very famous doctor that I now work with, actually said that to me. And I went, where? You come to my website and you tell me where. Where am I doing that? And he was like, oh, you're not. Oh, they told me you were doing. No, you're not. I'm sorry. Okay. So I did not monetize the IC network because of this constant criticism for decades. And it's 30 years later, right? And so let's talk about today. If I were to start a group today, I would have to monetize it. Okay. Because you have to pay your bills. How would I do it? Well, if I were an expert, I would charge for my time coaching. And I am an expert now, and I do charge for my time. But the question is can somebody who's not an expert charge hundreds of dollars or thousands of dollars for their time? And I think that I'm very torn by it. You know, you got a master class in IC from me today for free. This is a master class. No one is doing it like we're doing it. I sat on the U.S. Army research panel for a decade. I attend all those meetings, and I'm giving it to you for free because I want to leave a legacy. But I have a store that pays my salary. So do I think you should pay somebody a couple $1,000s to take a class on IC? No, I don't. But I think that they deserve compensation. I just don't think a couple $1,000s is it's the right amount. I mean, basically it's I mean, I understand that only patients who have money can afford that. So you're preferentially favoring the patients who are rich. But what about the patients who are poor and can't afford that? Don't they need resources too? So I'm kind of for the patient who's poor. Michelle says, what gal is charging $6,000? Yeah, I know, honey. I know. Because they attend these too, and then they charge you money for it. And I have a hard time with that. I have a real hard time with that. So this is let me tell you what I'm going to do. And this is the start of it right here. I'm creating an online masterclass of videos that will be free. There's going to be like 20 videos. We just had a new study come through of a university who did something similar. I took their program. I'm expanding it. There's some things they did that I didn't do. I'm not going to do. There were a lot of things that they didn't do that I'm going to do. I'm creating a series of videos that will be your masterclass. And if somebody is a medical professional and they are providing you essential medical services like physical therapy, they deserve the money. If somebody's helping you with your diet, they deserve the money. They deserve the money. But do I think you should be paying thousands of dollars for a course on IC? No, I don't. I don't. And you know who you are. And if you're watching this, I'm sorry, honey. I'm sorry. It's about finding the right balance here, because there are far more patients who can't afford anything, and we can't leave them behind. Right? Does that make sense? So listen, if one of you wins the lotto, I'd love a donation. You know, I can remember, like we had, for example, a new book that came out years ago, and it was for men, and it was written by two doctors at Stanford. Uh, and they sent it to me to review it to me. And the entire book was a pitch for their extremely expensive retreat. And there was like nothing in there for patients who couldn't afford to go to the retreat. And they wanted me to promote it to them. They called me up and I went, guys, what about the people who can't afford to go to your retreat? What are you giving them? You've given them nothing. You've given them nothing. And of course, they rewrote the book and they started putting in more and more and more, because we have to understand that the vast majority of patients suffering with disease and disability and injury, honey, we're on limited budgets. I lived on credit cards for 5 years. I lived on credit cards for 5 years. Thank you. Yeah, thank you, Becky. Becky says, you're such a blessing. I'm glad to be a member of the IC network. Donate when I can and buy from your store instead of Amazon. Mary says, how about credit card donations per month? I do value several organizations. We do have, you can sign up for that. You can sign up for that and pick the amount you want. But remember, we're not a tax exempt organization. We are a health education company. And even now, I mean, I've had several doctors over the years say, would you please start another nonprofit? And, I worked in nonprofits. I did fund development for nonprofits. I've been on boards of nonprofits. I have fired executive directors. I have hired executive directors. And this is the thing about nonprofits, is that they do not play nicely in the sandbox. They're so desperate for money that there's just infighting everywhere. It doesn't matter the nonprofit, doesn't matter the industry. I got fired from the last nonprofit I worked for, because remember, I left pharmacology because I love animals. I was doing fund development while I was getting my master's and my PhD. I got fired for having IC. They were vicious. They were vicious to me. And I just don't want to work in that sphere. I don't. Now listen, if I won the lotto, that's a whole nother story. I'll tell you exactly what I do if I win the lottery. Number one, I'd set up a research foundation for sure. And because there's so much research that I think we should be doing that's not being done. So let's say I won $500 million, right? After taxes. Okay. And after the family foundation is set up for 50 million or whatever for everybody in our old age, what am I going to do with the rest of the money? Number one, there's going to be a research foundation for sure, because there's a lot of research we can be doing on chronic pain. But you know what the other part of it's going to be? It's going to be for low-income patients to pay for college, pay for tuition, pay for medications, and give you grants. I would not be here today if I had not been with my parents. I can tell you right now, I was 32 years old. Overnight, my life changed. I could not walk without sobbing. I would not be alive today if I had not moved in with my parents and they did not care for me. I have lived at home this entire time, and now I'm caring for them. I've been caring for them for 20 years, which is the least I can do, given the fact that they cared for me when I was in such terrible shape. So it's not like I'm walking on a lot of money here, guys. You know what our power bill was this month? $917. $917. That was our PG&E bill this month, because my dad is always cold and he turns it up to 72 or 73. It's up at 73 last night when I went to bed. And I had paid the power bill for 25 years, among many other bills. And I finally last fall was like, hey, you know, they have pensions. My parents have pensions. They're fine. I don't have a pension. The only pension I'm going to have is when I eventually sell the IC network, which I might do eventually. I don't want to, I want to do this work until I'm at least 70. Right? I mean, I love what I do. But, yeah, no. Amy says gas and electric has gone through the roof in California. It has. You know, and the sad thing is the more we conserve, the less money they make, then the more they're going to raise the price because they need the money to pay for all those retirement benefits and pensions and salaries. Doesn't matter what we do. If we conserve, they're not going to have the money. They're going to have to raise the price. So, and yeah, Amy says exactly the same with water. Yeah, our water bill is probably $300 a month. Kristen says, I wouldn't be able to stand it that hot. My parents have been like this. My dad is always cold. My mother is always hot. But now that he's taken over the bill again, it's like, all right, do what you want to do. I can't afford 73. I can afford 68. Amy says, you think it would go? Oh, yeah, no, they just, the water agencies just petitioned to raise water prices 10% right before the storm. There's no excuse for raising the water prices now. None. Because all of our reservoirs are full. And did you see, Amy, that they are releasing water out of Oroville now? And are our biggest reservoirs in the country. Yeah, San Diego Gas and Electric. Yeah. And you've got the nuclear power plant, for God's sake. You got San Onofre, right? Isn't that down there? You know, so anyway, I really appreciate it when you guys buy from us. And again, I think we all have to make money. I think we all have to pay our bills. But I think hopefully you see from what I've done that I've never tried to do that. That my market is not the wealthy IC patients. My market are the patients who aren't wealthy. I want you to have resources because I work with you every day. And so I would just encourage you to be very, very cautious when you see ads online for people that are promoting classes on IC. And you need to look at their experience. You need to look at their age. You need to look at their level of expertise and look beyond the website. You got to think logically about it, right? Sempra had $2 billion in profits. I know, man. Same with the oil companies. We're just being conned. You got to understand, guys. You got to understand. Follow the money, honey. All this conflict, right, left, blue, red, it's deliberate because the big corporations want to keep you so preoccupied by the conflict that you don't see how they're skinning you. They're skinning us all. You look at that Rupert Murdoch deposition transcript. He said, oh, I'm not blue, I'm not red, I'm green. I'm here to make money. And if I have to tell a lie to make money, I'm going to tell lies to make money. And it just becomes more and more obvious now that the super, super wealthy who are not paying taxes, who don't want to pay taxes, they want the working class to pay all of the taxes. The audacity of the uber billionaires to not support this nation that they live in is just nothing short of disgraceful. And so it couldn't be clearer today than it was back in the 1930s. It's all about keeping us busy with made-up conflict, or not made-up conflict, just pushing the far right and the far left to keep everybody else preoccupied so they don't see how we're all being fleeced. And believe me, we're all being fleeced. And so those energy companies are making $1 billion in profit. They don't care that you have to choose between food and and that's the other thing. I mean, you go back in the 1950s, the CEOs of the company made you know a good salary for a CEO of a company back in the 1950s might have been $200,000. You compare that with what CEOs and executives are making now, 25 million or more with stock options. Where do you think that money's coming from? They're taking that from their workers and they're taking that for their companies. Nobody needs $25 billion. For God's sake, there are people suffering. Elon Musk buying Twitter, what a waste. He could have put that money into solving food problems and poverty. But no, it's all vanity. It's just disgraceful. Yeah, and stock buybacks, exactly. So I don't know. We just have to, we got to live our life. Listen, it's a good day. If you can look in the mirror at the end of the day and be proud of what you've done that day because you've helped at least one person, that's a good day. I try to plan and it's hard because the bullies are out there. I try never to be a bully. I try never to say bad things about anybody. I really try hard. A lot of people are kind of intimidated. It's like, if you're Jill, I'm just like you. You shouldn't be afraid of me. I have the same learning curve you have. We're just trying to help in our own ways. Sue says, since COVID, my husband's been working from home. His company does not pay our Wi-Fi or office supplies, and there are no big raises. I don't know how companies are getting away with that. Plus the electric for being online all day, and this is happening everywhere. Yeah, I mean, the thing here is that I have 3 computers on every day, minimum. I have my work computer, I have my streaming computer, I have my backup computer, which is replacing the work computer, and I use all of them to run the IC network, all of them. And it's impossible. It's impossible to do it all on one computer. It's absolutely impossible. Yeah. Yeah. It's so, and listen, we just gotta, I like, people ask what your religion is. My religion is a church of kindness. I just want to be in the church of kindness. Having faith and just, and that's the thing. We were talking about having a cancer diagnosis. See, the thing is here's the thing that will make you stronger for IC is once you've had a moment where you were literally begging for help and you're begging God to help you and you're begging doctors to help you, it changes everything. Because you realize up to that point, the car, the house, the fancy stuff, pointless. Life, that having somebody who will put their arms around you and hold you when you're crying, that's a good life. Being able to put your arms around somebody else who's crying. Like, I'm a great day. I do not need to go anywhere fancy. I do not need a fancy car. I drive a Nissan Rogue. A perfect day for me is playing games with friends. I have no aspirations of grandeur here. Mary says, good health is everything. Yeah. And money is precious. You think about all the money we spent as kids, all the suits I bought when I worked for the feds. I don't even, I'm not even into getting degrees now. I mean, I got 3 college degrees, but they were cheap back then. Would I encourage anybody now to go all the way to med school and get $300,000 or $400,000 worth of debt? I don't think so. unless you come from a very wealthy family, and that's scary, and that's why we're losing so many doctors. When I hire somebody for the IC network, I don't need a degree. I don't need you to have a good degree. I need you to be able to write a sentence, to write logically, and to do whatever I'm asking you to do. So I want to see work product. Show me what you can do. Anybody out there right now, if you like to write and you might be interested in getting paid to write articles, send me an article. Show me what you can do. I'm always looking for writers, always. And I always look to IC patients first because I know you're at home. You know? I'll tell you a funny story, though. I did have an intern who had IC who interned with me. She had one project, and she had months to do it. She needed to write an article on what are the issues that college students face when they're disabled. And she missed every meeting that we had. It was interesting. And by the time I got the article, I couldn't use it. It was written like somebody was on Twitter or social networking. And so I get the article, and it's like, well, I don't have any college problems because if I need money, I call my dad and ask for money. Okay, not useful. And so I actually, I told her I couldn't use the article and without rewriting it. I said, it's no way, it's not publishable. And she was like, well, you can't change it. And it's like, well, you know what an editor is. And she's like, no, you can't change my work. And I went, okay, I handed it back to her, or sent it back to her and said, we're done. So she did not know how to write well. So, just show me your product. If she could have written a logical paragraph, I would have hired her, but it is what it is. Anyway, okay. Any other questions, comments, concerns, anything about pelvic pain you'd like to know? We got a bunch of people who just came in on YouTube. Hi, YouTube. So we're here talking about pelvic pain. Pelvic pain caused by muscles, by nerves, by organs, by bladders, by bowels, by anything. And we've been streaming now for over 3 hours. Kristen said, all those fantasies, things don't mean anything. Being pain-free and happy are the riches I seek. Exactly. I just want a small, safe home, all that sort of stuff. So, all right, guys. Well, let's call it here. So let's, who are you rooting for Best Actor? Is it going to be Brandon or is it going to be Austin? Is Brandon going to win for The Whale? I'm torn. Austin did a great job with Elvis. Oh my God, he was so good. But Brendan Fraser was just, he's such a good man. And he did such an incredible, incredible job in The Whale. So I'm torn. And I hope that Ke Quan wins for Best Supporting Actor. I'd love to see that whole movie and that whole cast get their awards too, because that was an amazing movie. Mary Kirk says Austin. He was insane. Sue says, my physical therapist is hesitant to use a peri wand, even though my doctor recommends it. I'm wondering if I have the right physical therapist. Michelle says, is Miralax okay for IC? Well, is Miralax, the correct question, is Miralax okay for pelvic pain or pain originating from the bladder? Yes. Yes. Remember, to have good bowel movements, you need to have 20 to 25 grams of fiber a day as a woman, a man 25 to 30. So how about boosting your intake of peas? If you can eat a cup of peas every other day, man, that's a lot of fiber, and that'll help bowel movements massively. Peas or beans. So look at the labels. 20 to 25 grams of fiber a day is needed for good, healthy bowel movements. Most of us are down in the 10 or 12s. Thus explaining the hard, painful bowel movements that we have all had, myself included. Michelle says she's doing Heather's tummy fiber. I have a big tablespoon of Heather's tummy fiber right here in my smoothie. Sue, my physical therapist is hesitant to use a peri wand, even though my doctor recommends it. I'm wondering if I have the right physical therapist. What's a peri wand? Let me look at it. No, it's not, Michelle. I do. Listen, my go-to is green peas. I just microwave a thing of green peas, and I listen. I can go to town on that, hot, cold, whatever. I love green peas, or refried beans. Make having burritos and things like that. Sue says, "Is it safe to use Miralax every day? Because with Botox, I need to use it because it makes my muscles weaker." Ask your doctor. I think it is, but you need to ask your doctor. And yeah, Michelle, we absolutely talk about it on your coaching call. So hold on, let me look at a peri wand. Where does a peri wand? Oh my God, Google keeps asking me. I would like to use my location. Stop it. You don't need to know my location, Google. I don't know what a peri wand is, hun. What is a peri wand? Lori uses a Thera wand. I use a icy relief wand that you can buy from Desert Harvest. We also have this wand that I quite like. Oh. This is from Intimate Rose, right? No, this is Soul Source. This is from Soul Source. This is a fabulous wand. And you can see when we get our model out that how easy it is to get to these muscles if you need to work with your deeper piriformis muscles, stuff like that, right? So you can get this in the IC Network shop under pelvic physical therapy supplies. So are the Oscars starting at 5 our time? Normally we have taco salad. It's been our tradition for 40 years. We have taco salad and watch the Oscars. Sue says she has one, but she doesn't want to show me how to use it. Weird. Well, Sue, you got the book. I mean, you've got this book. This book will help you understand your anatomy. This is the book that helped me figure out how to use it more than anybody else. So magnesium equals poop. Yeah, that's true. Mary says she's coming to my house for dinner. One day, when things get better, we will, and we can have, I'm still not ready for in-person conferences. Yeah, Michelle, that's the book on our website. Just go to the store on our website and it'll be on the front cover. IC 101, either IC 101 or just go to the book area. You'll see them both. Michelle says she's doing the magnesium. I'm doing a little bit of magnesium glycinate because it's supposed to help with blood pressure also. I'm a little afraid to do a normal dose because I'm sensitive and I don't like having messy poops. I already deal with messy poops every day with my parents. All right, guys. Well, I think we've come to the natural end of our meeting. So I'm going to give you your homework. For 15 minutes a day, I need you to do something for your spirit and your soul. Put down the phone. Michelle says on an app. Which app, hun? Is it the diet app or is it the Flare app? I mean, the bladder tracker app. The apps have just not been particularly, I mean, they're cool to do. They're expensive. They're very expensive. I know, but which one? Is it the food app or the bladder tracker app? You know, it's coming up with the money to update the app. Every time you update an app, it's $20,000. And during COVID, we just didn't have the money, not even close. So thank you, Denise. Oh, the food one. Yeah, the food one is the one that needs to be updated. Yeah, apps are very expensive because they all have to be updated for all the new operating. The diet app is probably 7 or 8 operating systems behind right now. Yeah. That's why I did the card. You know, we have this card. So not everybody carries a cell phone, and the problem with building apps is you have to make them work on iPhones and Androids, and you have to make them work for this or that, and it's just so freaking expensive. And so we also created this really simple bladder-friendly card. What's bladder-friendly and what's bladder damaging? So I don't know. I don't know what we're going to do with the apps. I've got them up and running, but there's part of me that wants to just kind of take them down. To do a really good app would probably be $100,000. And yeah, she says, know that there are subtypes, that everything is technically interstitial cystitis. People are getting labeled with pelvic floor dysfunction. They don't know how to find you, but I do refer people to you. But they say I don't have I don't have icons. What does that mean? Icon. Just send it to the what? Just Michelle says, don't, please don't. Okay, I won't. I won't. If you tell me to leave them up there, I'll leave them up there. I just don't have, I don't have the $20,000 to update the diet app right now. I just don't. You know, all the production costs have risen massively. The books, the IC 101 book now costs $19.50 to print, and we're selling it for $24. So, we had just had to raise that price to $26. Just all the prices are going up everywhere. I'm just doing everything I can to keep everything as affordable as possible. But, you know, we're getting squeezed. We are getting seriously squeezed right now. So, and all nonprofits are, and all companies, health education companies like mine, everybody's getting sneezed. We're trying, but please don't give your money to Jeff Bezos. Please shop on the IC network instead, okay? All right, guys, I got to go. I'll talk to you later. Be well. Okay, here's your homework. 15 minutes a day. Do something for your soul. Come on, you got to do something that's nourishing to your soul and spirit, whether it's going to church, sitting outside, walking through the redwoods. Do something that just will give you a little bit of peace. I need you to do something for your knowledge level. Read. You can read a blog every day. Come on onto our website. Come on. There's a lot of stuff to read. Just work on your knowledge level because everything's changing. Everything you learned 10 years ago, 15 years ago, thrown out. It is a new world, my friends. It is a new world. We've got to update our knowledge. For 15 minutes a day, I need you to do something for your pelvic floor, your bladder. Make something bladder friendly. Get down on the floor and do your exercises, your stretches, or use your wand. We all have to take a little bit more responsibility for our daily routine. At least I do, because I should be, when I get up in the morning, do my SI joint therapy. I should do my stretches and my internal work every day. I don't because I'm freaking busy. But it would be nice to have that set routine in, right? The one thing I am doing now is I am walking almost every day. And I feel so much better just for that. I can't do it today because it's storm, but just getting out in nature is just so healing. And putting away the damn iPad and just getting away from social networking. And then for an hour a day, I'd love for you to laugh, because when you laugh, your brain modulates pain. When you're laughing and you're in pain, your brain goes, well, your life's not at stake, so I don't need to make the pain worse. If you're really anxious and you're in pain and you're crying and you're in pain, your brain goes, oh, maybe your life is at stake, and intensifies it. And so laughter truly is the best medicine. It is very, very important that we lighten our day. Lighten our day a little bit. So get out there and laugh. Come on. Some of those videos are hysterical, but just talking with friends, playing games, things like that, just so important. Okay. All right, you guys, I absolutely wish you well. Be well. Have a wonderful week, and hopefully we will see you again next Sunday. Send me strength dealing with my parents. I think as I told my old friends when I used to play World of Warcraft, which I can't play right now, I'm the only person who had to leave a raid group because I had to go do an enema for one of my parents. It's just getting worse. So send me your healing vibes. Life is challenging. So, all right, guys, I'm going to say goodbye to YouTube. See you later. Have a good one. All right, Facebook.